بسم الله الرحمن الرحيم. نرحب بكم في نقابة الأطباء السودانيين بأيرلندا SDI في هذا الويبينار بعنوان Covid-19 Learned Lesson and the Roadmap. يسعدني ويشرفني أن يكون ضيوفنا اليوم دكتور عيسى حامد ودكتور Ezzan Kunna. They're both public health specialists with a great experience. We'll start with Dr. Eisa. I will hand over to you.
Thank you and shukran Amin. Hello everybody, I hope you are hearing me clear and loud. Really pleased to be here today with the colleagues from Ireland, the UK doctor and the syndicate. It's a pleasure and honor also to be with Ezzan, my old friend Ezzan. Happy to see you all, and I will be exchanging between Arabic and English. I hope that is okay. I hope all of us are Arabic speakers here also. Please let me know if there are non-Arabic speakers so I can continue in English language, I mean.
Okay.
Okay, great. So I will go without...
You can start sharing your screen.
I'll start sharing my screen. الموضوع هو العبر الدروس اللي استفادت من الكوفيد من بدايته بالذات الويف الأولى وخارطة الطريق. حقيقة أنا يعني ركزت على كل الدروس المستفادة من الوباء ده وبالذات في التجارب الناجحة والتجارب اللي بفتكر أنه ما كانت successful في أنها to contain it. There is a lot of unknown of course, not blaming, but just to learn from it. And يعني شنو المفروض يحصل بعد ده بيعتمد على جزء من الليسون learned وجزء من الاشياء of course coming on the way. يعني not all the lesson learned it has to be useful. Of course there are many unknown things coming. We don't have many public health intervention, no medical intervention up to now. Most of the intervention has the non-pharmaceutical intervention, MPIs basically. There is no treatment, there is no vaccination. So those lessons learned is just to say where we have gone wrong and what we pick up from there. So this is important statistics. You all know it, but what I'm trying to take from it here that these are cases. And if you look at the colors, the yellow and the green, these are basically the Americas. America is basically the numbers are pushed by the US, and of course the green is Europe. And what we see here is that totally now globally we have around 50 million cases. All those cases, of course, some of them unfortunately died. Around 1.25 million person died. And some are recovered, but this is a total reported number. I use the WHO website, so those colors and those regions are divided according to the WHO, how they deal with the world in terms of geographically how the organization look at the world. So there could be many other ways to look at it, but if just we divide Americas, all the America South and East, all the European together, and then Southeast Asia, which is India, excluding China, and then you have the Western Pacific that has China and Japan and others. Then we have Africa, which actually excludes Sudan. So Sudan is not part of Africa. In the WHO, we are part of the Eastern Mediterranean, هذا اللون التركوازي. بالنسبة للسودان أنا ركزت على إقليمين. الإقليم حقنا الأفريقي لأنه even if WHO does not consider Sudan as part of that, if we look at the West and the South, these are part of the African region of the WHO. Chad, Central African Republic, Southern Sudan, and even in the East, Ethiopia and Eritrea actually with the Middle East. So those numbers is important for us because there is a lot of traffic movement and we share borders. So I look at both the numbers. And of course, with the Arab world, I look even all to the East, to Emirates, to Qatar, Saudi Arabia, Egypt, and Libya, and I will show those numbers. So what are the daily numbers now globally? So globally, there is now, as we speak of today, I look at the website, around 500,000 cases per day. This is quite high. This is unprecedented even with the second wave, with the first wave. So the second wave is really high, and this is putting everybody on alert. Of course, it's happening more in America, but if you look at Africa, the color is quite blue and very low in the slides here. Africa, they have around daily cases around 4 to 5,000 cases. This is the entire Africa excluding Sudan. We are part of the Middle East. We are having a different scenario now. We are entering into the second wave, and this is why this workshop is so important. Even during the first wave, the highest reported number in the Middle East region is around 18, maximum 20,000 cases per day. From last week, the numbers here is 30,000 cases, 33,000 cases actually yesterday for the regions, and I will come back to Sudan. So that means even the daily numbers now, and as we are entering the second wave in the region, our region actually is almost far exceeding the highest number. But there is less anxiety, and we will see why that. Sudan, where are we now? Sudan recorded, as you can see on the screen, around 14,000 in total. Of course, this number is very conservative given that we have no more, we have no capacities to test like our neighbors, but still, so these are the registered numbers. So it looked so low, but even our highest number during those epidemics, here, if you look at the red circle, were in April, May, June. So, but we are heading to these numbers if we just compare pre-epidemics, the small circle, with the second epidemics, we are going on that number. So we might enter, because of our region, the Middle East, and also some of our neighbors, we might enter into second wave. Now, the case around 30,000. The last time we had 33,000, sorry, 33 cases, around 30 cases. Let me make that number clear in Sudan. So the last time we had 30 cases, it was in early September, late August. For the last 3 days now, we have 30 cases consistently. So after the first wave, that is ended around August, then we have no more cases, 1, 2, 3, there is a spikes according to people traveling, but now for the last 5, 6 days, we have 30 cases per day and going a little bit smaller, higher, 39 cases given the limited. So this is something that we should keep an eye on because this takes me to the, and of course, this is the region. So Sudan cuts between Africa and the Middle East. None of our neighbors in the Arab world recorded less than 100,000, 60,000, even Saudi Arabia nearly 400,000 cases. Sudan only 14,000 cases. Even our neighbor Ethiopia, which we have a lot of exchange of travel and activities, economic activities with them, is more than 100,000. Southern Sudan 3,000, Central Africa 5,000, Chad a little bit over 1,000. So these neighboring countries show that we have issues of testing, but still we should monitor the situation on those countries here around us because our epidemic will be driven by those factors. I'm not this coming from outside. Now in the global, we have to acknowledge COVID problem is a community transmission. It's no longer those fears. But of course, as now you have only 39,000 cases, you have to be very careful about borders, movement, land, air, all those from your neighbors where they're already reporting higher cases. I have like 5, 6, 7 lessons. I hope not to elaborate more, but I have elaborated in a couple of them. People talk about many experience, countries that have done well. People always talk about Sweden, I mean, given whatever region they're living in. But I live in Southeast Asia. I've been here for 8 years. And I think the epidemic started from here. Let's see what they have done here good. So I look at Taiwan, I look at Australia, which is part of the bigger Asia Pacific. And both countries have similarities. Both are islands, economically in the same category of in terms of development. Population also around the same. Of course, there is differences where Taiwan is quite packed, small island with high population density, people living in apartments. But the two countries has totally different pictures when it comes to the number of COVID cases. So if I just go faster, the red color is Australia, and the down black color, that is almost like a line, this is Taiwan. So Taiwan, until this month, they have around 500 cases. They're neighboring to China. They have all basically I could say the environment and the proximity, the high epidemics. On the other hand, Australia and Taiwan in January, they recorded the same number of cases. So they have like four cases. And then from there, Australia just went up to 250,000, but Taiwan maintained that. What happened with Taiwan? The first lesson that we learned globally now, after the first wave, those countries who acted early and aggressively, تحركوا بسرعة وبصورة موسعة وضغطة, they get the best results. China included, by the way, and I'm gonna talk about China, but here Taiwan. So Taiwan managed to do that. And the Taiwanese government, what they have done, because they have a SARS epidemics before, the other SARS, they had those plans in place. They have epidemic preparedness plans. They have mechanism. They have a national body, coordinating body that centralizes the response. And this is something helps them. So when the first 4 cases came, immediately they closed the borders, except for, of course, the Taiwanese people that are allowed, and some of them were evacuated, but they closed all the borders. And of course, there's an island, there is ferries coming from China, there is flights coming from part of the world. And they tightened the travel regulation, particularly for people, Taiwanese coming back to Taiwan after, of course, the months of April and May, where even there is some foreigners allowed to enter. They have those strict surveillance system where all the travelers, they have to go through those screening processes. People passing through the borders also, they have to have a digital tracking. So basically you have your data and an app installed in your phone where you will be compliant for a quarantine. So this is very important, closing the borders, but they never had a lockdown. They did not. So the aim is to see who is suspected, who is a contact, and then to lock them, but the entire 23 million people were free. And because people were asking, and they're gonna ask today also about the word-based strategy. So, and of course, so they have tighter regulation, close the borders, except for Taiwanese, and Taiwan has capacities because of the SARS. They started on a nationwide testing. They test as much as they could, even people with previous pneumonia-like diseases also they were called and they were tested. And then out of those testing, also whoever was suspected or have a kind of a COVID-like symptoms, they will all have to go under quarantine for 14 days, home quarantine, even if you test negative. Once there is, from this mass testing, whoever is identified asymptomatic positive or symptomatic positive, and you are a contact, of course, you'll be tested as a trace, through the tracing mechanism, and then you will have to go quarantine. The rest of the country, they go as normal as they like. And this quarantine, of course, Asia here really make use of the technology, the innovations in terms of mobile phone tracking. So it's a technology enforced tracking, so they will know whether you break the quarantine or not. And they introduce punishment. I mean, very harsh punishment could reach up to hundreds of thousands of dollars, in $1 million actually in Taiwanese money, that's around hundreds and thousands of US dollars. And, but they were not money, of course, people being punished, but I would say why? Because also the population was sensitized. And Taiwan, basically they quarantine around 400,000. So basically this is like quarantining a big number of people. And of course they have to provide for them social support, whether that meal or even those who are at their home, they arrange for delivery for groceries. And of course, even going further to trying to expand their social networking and having for them friendly chat through WhatsApp, through other social media. So they check on you, somebody check on you and chat on your well-being. So this social support, of course, is an investment, is very important. The other thing that immediately after the first 4 cases, the government has a stockpile of masks. People here use masks generally. When I first moved here and I went to Hanoi, in Vietnam, people use masks because of the dust because of the past epidemics. So they are very sensitized. But what the Taiwanese government have done is to produce more than 20 million masks. And even those number, of course, for 23, that is a mask per person. They were being rationed for those, of course, contacts, ferries, and other people. And this is very important to have those masks. As I say, there was huge compliance because of the past epidemics. The general population themselves, they know hygiene. And we have to stress hygiene here. Those hygiene practices become routine in Asia here. People always having gel with them, washing hands. The places are equipped to do that. And so there was general compliance. And this is important as you go to enforce those hygienes, whether you have an epidemic or not, because it will pay off when you have an epidemic. Okay, so this is the first lesson. Act fast and rapidly. Even with minimum, no lockdown, what they have done basically is testing in terms of just public health intervention if we look at it. And of course, mask at that time even not recommended by WHO, and of course the quarantine, if you consider quarantine as a public health interventions. The second big lessons that we learned from the epidemics is that we really need to have enhanced surveillance, where you have the ability to track people who arrive and to see who are suspect and to trace all those suspects, and then to have testing capacities and the ability in terms of capacities to respond. We talk about those response, either visiting or giving masking or social support or even quarantining. Those are very important, but this is surveillance basically. So those surveillance, people talk about China, that China managed to keep the epidemics low because of policing. No, I mean China and Taiwan, they are not friendly. You know that they have very big problems. So we look at both countries. So Taiwan is a democracy, open democracy with much liberal system. China is a different context. But people talk about the experience of Wuhan, but actually what happened in China, that's not the Wuhan trick. What happened is what China have done after that. China have set up a very strong surveillance system that is able to track any person and trace any contact for that person suspected, and then respond timely. And they have deployed really high-tech surveillance system that, I mean, basically using tracking in partnership with big company like Alibaba, Alipay, where every Chinese, and with WeChat, there's another company, Tencent, where basically the Chinese people either use this or both of them. So there's millions of people who are using those, and through apps installed, China are able at least to monitor movement of every single person on those areas, and you can move freely as you want. But if you were in a close contact where there is suspected cases, then you will be identified. If you were in an area that is designated as a no-go area where a person is stay at home, your app would show those colors. And this surveillance, that's what really helped China. China, after the lockdown of Wuhan, was open. Economy was moving on. China now recorded economic growth. So China was never locked. They relied on, okay, if there is any suspected cases, we're gonna immediately get the data, we have it in the system, and we're gonna respond accordingly. So what kind of response? So the response include many things, but sometimes they do lock for that area, down. But most of the time, what they have done is mass testing. The Chinese, of course, have capacities to test up to 4 million cases in a day. This is happening in real 10 million cases in a day. So basically the entire population. And out of those testing, that is actually the 4.5 million happen in a district in China, they were able to discover 146 asymptomatic cases. And you would imagine what happened. These people were, of course, isolated. All the contact were also traced and quarantined. So the buzzword here is that you need to have that system. We don't have to have a sophisticated system, but we have the now available everywhere, even in rural areas, everybody has mobile phone, everybody uses some sort of that could help in setting up. So this is the second. Lesson learned. Actually, this is supposed to be number 3, but I put it as number 2, but it's number 3. Number 3, what I look at the Lancet study. Lancet study that was published by Yuli and others. They look at the policies, experiences, practices from 133 countries. Basically, these are none, as I said, pharmaceutical intervention, basically societal responses from those countries, and they have drawn some lessons. So what really worked from those measures, because we have seen many experience. We have followed what Italy have done. We have seen what happened in the US, where there is issues around governance for the response, I mean, between the central governance, CDC, and then the task force. But also we have seen what happened in UK. So, but the Lancet study, the beauty of it is it looked at those societal response, basically in all of those different group of countries. And this includes, for example, you know, all countries encourage social distancing, of course, without saying much. Also the hygiene, some of the countries, they have lockdown, school closure, workplace closure, canceling those public events, banning gathering. Some countries just issued a stay at home, like what happened here in Myanmar now. People are just advised to stay at home, and the community help to compliance, and also internal movement of public transport between big cities being either interrupted or monitored. These are the key things. And I have highlighted here those 6 measures that globally implemented, and the Lancet study looked at what effect they have done. Because if there is something work, then that help us to look at it in Sudan. We're speaking here about what we could do in Sudan, and then apply it. And so as we speak, look at those highlighted, underlined one. So the study found that those societal response can only work if you introduce them, like you want to introduce, say, school closure, or when to relax and kind of lift the school closure, can only work if they started early enough. And this is the buzzword, early enough, when, by when. So in the study, they found that usually the reduction, for example, when you introduce the school closure, and of course those highlighted, the reduction varies, like how they impacted the number of cases. This is not modeling, this is actual data from published data, and those researchers look at what was the case after introducing or lifting those societal response. It varies very much, between 3% to up to a quarter of the cases were reduced from the time of the introduction. And then they look at 28 days of for example, school closure, and then they see how much the school closure and all those together reduced the epidemics is up to 24%. But it varies. For example, they found that the school closure the effect when you close the school today, you need up to 14 days before really you would see those reductions. If you ban public gathering, those big public events, the effect is immediate. After 1 week, immediately you see the number of cases coming down. Okay, so if you lift them, so you do school closure for 1 month, some people go on that, but this is the average globally that have been introduced. If you lift them, the increase also, they have seen that the increase happened up to 11%, so from 11% up to 25% increase after 28 days from the day they lifted the bans. But of course, the effect also varies. Those school plus closure, when you lift them, after you close and you lift, the cases start to increase immediately from 1 week to 14 days. So the message here is that without going to entire lockdown, just if you focus on school closure, workplace closure, ban of public gathering of 10 people. 10 people should not be together. 5 people are okay. And of course, you encourage home stay for people who have symptoms and contact. And you monitor the internal movement, particularly between big cities where you have problem and you have no problem in those areas. If you introduce those measures, you would have an effect if you started earlier. So if you desire to, for example, to keep the number in Sudan, just say hypothetically, around 30, then we should start from today. So the effect of those, as I said, it starts from 1 week, and in some cases up to 60% reduction that happened. And sometimes it gives you, even when you lift them, you would not see increase up to 3 weeks, particularly for public gathering, and they vary those measures. But people usually encourage to introduce all of them together. This is very important for us as an option when we don't want to go into lockdown. What intervention and when to introduce. I will share the link for the Lancet study, but this is some of the key lessons learned that societal, we should look at what response worked for us and by when we should introduce it. So this leads us to another big mistake that happened, particularly for Europe. I mean, America, they never actually responded very well, I have to say, for the epidemic. So if you look at the curve for America, it has always been up and flat. But Europe has its first wave, and now it's going to the second wave. So what happened and what wrong? That European countries, they relax those measures, societal measures, they relax it. We have seen, I personally have seen crowded beach, we have seen all those entertainment areas, pubs and clubs full, and basically the young people and middle-aged people kind of sacrificed the elderly, and now we have seen the effect in many UK and many EU countries. And today, the daily numbers in Europe in total around 300,000 cases. This is huge compared even the highest epidemic in Europe, the total never had more than 80. So now you're already at the beginning of the epidemic and you are already 2 times, actually it was 80,000 and this is 300. This is 8 times or 9 times your peak and it's still early. So it's quite a harsh lesson that you can't go on. You have to look at those societal response, when to introduce, when to lift, and to continue to enforce those particularly social distancing, masking. It's not a commonplace in Europe, we have seen that. And of course, the most important things from all those Asian countries, I mean, talk about India, for example, the highest number in India were 80,000. These are billion of people. Even now, India, from the curve, is going down. One of the important lessons that also we have to learn from the epidemic, and we all have learned that without a strong political commitment from central governments, proper governance, and also poor investment in terms of surveillance system, epidemiological responses to control the epidemic, or fragmentation of those response between, for example, federal government and non-federal government or decentralized government. Those doesn't work for the epidemics. What we have learned from epidemics, most of the time, you need a centralized approach. And that is something also we have learned a lot. Even my colleague and I, Hatim and Mahdi, when we wrote our paper, we saw that what we need is a central information in Sudan and a decentralized response. الولايات تستجيب بنفسها للوباء. واكتشفنا أنه this was a wrong lesson from us, and I'm going to come back what lesson we also as public health expert we learned from Sudan. But what I'm trying to say is that there must be political commitment that is translated into funding public health program, funding surveillance system, strong multi-sectoral, and also epidemics and pandemic response must be centralized. Otherwise, we have seen this is very problematic. For example, the Spanish experience. The central government were basically blaming the regional governments and say this is their responsibilities. And of course, we have seen the toll on the economy. This is lesson learned that epidemics, health are really determinant for for your economic growth. And the effect could be sharp, could be immediate. People focus on other things, but now people have learned. So this slide from our presentation that we have done for the رابطة أطباء الخليج. قبلها حقيقة احنا كتبنا ورقة وزعناها أيام ذاك. We were very strong, حاتم المهدي and I, believing that we should say something in Sudan to advise. And I remember our advice was أنه تقوية وزارة الصحة الاتحادية وإدارة الصحة في الولايات والعمل على مركزية المعلومات ولا مركزية اتخاذ القرار. So today I learned we need actually a centralized response. What we learned was that the Sahel Ittihadiyya, people look at it still as the one responsible for health, not also for planning and policy. No, it's actually for intervention. وحمية الشمالية ورتنا, and without تدخل الاتحادية كانت حميات will go forever. So we have learned a lesson. We must have a centralized epidemic preparedness plans, funding and governance. تكلمنا في الوقت وقتها برضو عن زيادة السعة التشخيصية وقلنا أنه لازم تديسنترلايز المسألة دي ويتوسعوا يعني بشبكة معامل ريبوربوسينج معامل الدلن والإيدز. عندهم كان جين اكسبرت ماشيين في السودان أكثر من 80 فإنها دي كلها تريد purpose to do COVID testing وحتى تدعم sample transport system. We still in Sudan we have not learned that lesson. Still we have limited capacities. I mean, up to now, our capacity to test is still limited. And this is something we have to learn. So we have to go to the basics in Sudan, learning from all what I have mentioned, but important also within the health sector, we have to work. And of course, we have issues around health cadre numbers, peripheries, but also in the center, they are less in numbers, they are less kind of finance, incentivized, and also in terms of capacity to deal and also to even write plans. Still, we have problems. If Taiwan and if Myanmar, where I'm living here, have ability to quarantine a suspect, because you have two choices. Either you lock down or you say, okay, I'm gonna lock some people for the benefit of the rest. So if we really want to do a patchy lockdown and we wanna have the economy running, we don't wanna recommend lockdown, then we have to have big number of quarantine centers ومراكز حجر صحي للمخالطين و some social support. We have to think about how to do that. And if we have to quarantine 500,000 people, we have to be ready for that. وقتها برضو نحن يعني أوصينا طبعا ورقة حقتنا احنا كتبناها very early in March أنه immediately within 1 month you have to close Khartoum and even close other localities, not big cities, where there is one case or more at that time. Now, I don't recommend that. I don't recommend that we have to lock down. We have to look at those measures, masking, contact tracing, quarantining, using whatever means to quarantine as much number of people, stay home, school closure, workplace closure, but we look at the lockdown only on a patchy manner. But of course, this also to identify people who have COVID or their contact, you have to have testing capacities and you have to have human resource for health. I hope I'm not going too long. My screen frozen, but you see I'm crossing here some of the lesson learned. اتكلمنا وقتها برضو في شهر 3 and we have to modernize our surveillance system and use whatever platform and technologies that's available to link a central epidemiological unit بكل المعابر إذا كان في أرجين ولا بورسودان ولا الجوية electronically. Of course, or between all the states. Still, we have problems. Even حماية الشمالية, it took 19 days. Marawi, Karima, just a day drive to Khartoum. It took 19 days before the Ministry of Health Center Khartoum عرفت إنه الحمايات في الشمالية عددها كم ورقمها كم. وحتى بعد ذلك قدروا يتدخلوا وأعلنوا الوباء. We must have a surveillance system. It must be centralized. We can't leave it for الولايات. They are very weak and it doesn't work for epidemics. We have learned that even in bigger countries, modern countries, America and China, you have to have a central epidemic preparedness, central response, central budget. One thing also we have to look forward and we'll see من الزمن ذاك في أنه one of the things that we could expand not only for testing, for those labs for surveillance that could test any fever. At that time, we mentioned influenza and مرض تنفسي. I'm crossing it out now. I think now from حمية الشمالية we have learned we have to actually test every fever from some sentinel sites. And this could be done. We have now universities everywhere. They have their labs. We have many of the animal research institutes. المعامل البيطرية موجودة كلها. يعني في إطار الشراكة بتاعت الأوبئة المشتركة ما بين الحيوان والإنسان في برنامج عالمي اسمه One Health. We can use that and we'll be able to detect any fever to be reported electronically. And then at least if we have cases like now, the number we have 30, 40, we'll be able to do contact tracing, we'll be able to locate where they are and to respond intelligently instead of opting for just lockdown. And of course, there is many countries, they have developed their own homegrown modeling system, and then we study our own intervention, those societal response. In Sudan, we have different ways of responding than Asia, masking and hand washing, availability of those. We could model those things, and we see to what extent they help. If we have done patchy lockdown, also we could see how did it help in the situation. So those things need to be done. This is very important. One thing that Sudan has never really utilized well in epidemics is really using المكون الشعبي حقنا. يعني هاي تقوية الشراكة والتصدي المجتمعي، واحنا شفناها في ايام الثورة. الناس كانت بتجيب الاكل وبتجي للقيادة. يعني ما في اسرة سودانية في الخرطوم ما شاركت، الناس جات حتى ببساط من يعني قطع عبرة وبساط جنينة. القيم دي احنا في اللحظة دي في شهر 3 انا وحاتم تكلمنا عنها في ان احنا وي هاف انه تيوزت الان لجان المقاومة وغيره 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 في تألفيات الكونسترينس حقتنا في القطاع الصحي في ان نحرك المجتمع ده، لانه ما في public health intervention للكوفيد. I mean washing hands, surveillance, yeah, these are public health intervention, but most of the things these are all about population compliance. So this is the problem of the society can only be solved by them. We have still to utilize, and I'm going to talk about our model quickly. And of course, we have learned that. And what we have now in terms of structures, the epidemiological unit that were established at the central federal government or wilayat, they really need to be looked at. I mean, we are not arrogant, we are not patronizing here, but really they need to be reformed and strengthened. And I think أخونا أسامة شغال في المسألة دي، ويعني اللي فاتوا برضو كانوا شغالين. But we have to look at it, as I said. We have to talk to the central government. Epidemic preparedness and response, I can't repeat that enough. It has to be central. And of course, دور القطاعات الشراكة. We talk about القطاعات في السودان بالذات الأمنية. They have huge facilities. They have to be used in Sudan. This goes without saying, but this is just example here I'm giving for to what extent المجتمع كان حتى هو يعني سابق للدولة في السودان. يعني دي في من المنطقة حقتنا احنا قرية صغيرة في جنوب كردفان اسمها كرشولة. عندنا منظمة اسمها عياد الخير. الناس الشباب ديل هناك بمساعدات بسيطه جدا احنا قدمنا لهم قدروا يصنعوا معقمات يدويه هناك محليه ويوزعوها لكل المحليات في كرشوله ولا حولها. ما كان عندنا اي حاله، بس at least I told them it's gonna reduce diarrheal diseases, it's gonna sensitize the people. This is just they did for COVID. Very far from Khartoum. Of course في مبادرات كبيره زي مبادرات كسلة المشتركه، اخواننا ناس ناظم حيدر واخوان مبادره كاوده، يعني حتى مع وجود الحرب الناس قدرت ترسل معينات لكاوده. مبادره القضارف قدروا الناس يجيبوا معدات بتاعه بروتكشن للاطباء هناك. المبادره حقت البحر الاحمر سيميلر، برضه المبادره حقت حمايه الشماليه والجنينه. يعني دي كلها مبادرات بتوريك انه يعني احنا we could use more and more من الكوميونتي دي. المفروض يعملوا لهم امبريلا في الوزاره ويستفيدوا منه. حقيقه ان اخواننا في كسلة ناس يعني المقاومه في كسلة الاستراكشر اللي عملوه لحميات الضنك وللكورونا وغيره الان بيستخدم هذه الشبكه بتاعت المتطوعين ومتحركين في مساله معالجه الصراعات اللي الدايره هناك في كسله. يعني الايفكت حقها ذاته بقى يعني بيون هيلث بيساعد في حل قضايا مجتمعيه ثانيه. وحقيقه ان الصحه نحن في بابليك هيلث يعني وي بورو الكوميونتي ريسبونس من الحاجات دي، من النون هيلث انترفنشن. الناس كانوا يعني في جلوبالي في كل الناس عندهم نظام بتاع الكوميونتي موبلايزيشن ل whatever things happening في القريه، وبعد ذاك ليتر اون الناس بيدربوهم على الصحه بالتوعيه والتصريف الصحي، ويقول لهم الحميات شكلها كده وترسبوند. فاحنا وي هاف تو ماكسمايز المساله دي. ودي طيب المقترح اللي كان عملناه احنا في السودان، والمفروض الناس تولينا الليسون بعد ما شفنا الشيء اللي حصل في الثوره، انه شنو ممكن يحصل لو في كل محليه لجان المقاومه مع العاملين بالصحه هناك في المركز الصحي او الفريق الصحي اذا كان صحه المحليه، عملوا لجنتين مشتركات شغل مع بعض. ناس الصحه يكونوا هم الهيلث كوميتي، وناس يعني المقاومه يكونوا هم كانوا في المانجمنت والكوردينيشن كوميتي. واحنا فصلنا لهم، عملناه في شكل دقيق وتجرب في كم حته، وده كان ممكن يساعد كثير جدا لو اسي وما زال في فرصه انه يساعد. وقلنا في اللحظه دي انه يعني الناس يعني المقاومه دي بيساعدوا على توعيه الناس بانه يا جماعه يكون في شباب كده ماشيين، يا جماعه انتوا خليكم بعيدين من بعض، يعني تعزز التباعد الاجتماعي، يا اخي البس ماسك، دي محل الحمام هنا، قدروا ساعدوا هنا وهناك، عملوا يعني نفاير تفقدوا الناس المحتاجين في الاسر، قدروا حتى شافوا لو مثلا منطقه فيها اكثر من ناس والحكومه قررت الناس في مدرسه هنا ولا في حته الناس ممكن يستخدموها كمركز عزل كويس، وبعد ذاك هم يوصلوا الطلبات دي للناس. البيوت مثلا لو في بيتين ثلاثه الناس المفروض يطلعوا حسب توصيه المحليه هناك بتاعت الصحه، هم اللي يجيبوا لهم الموارد التموينيه. طبعا عندنا مشكله برضه في الموارد التموينيه، بتكلم عن السودان كله، بس يعني حتى في الخرطوم المزرعه دي عملت وكان ممكن تتوسع تكون في برنامج في شكل برنامج. فده المقترح اللي خطينا لهم. وناس اللجنه الصحيه اوف كورس they would do all the health work بما فيه الارشاد الصحي والمسح لناس المنطقه مثلا نزله من الفات وكده، وحتى المفروض يكون عندهم تلفون، يكون عندهم كاباسيتي على المستوى المحليه، يكون عندهم محل العزل الصحي للكارانتينينج بتاع الكيسز بدل يتقفل كل المحليه. Anyway, this is one of the lessons that we have to use المكون المحلي في كثير من الحالات اللي بتساعد. بيحصل هنا في اسيا حقيقه هنا. احنا we have seen. انا مثلا مرات الجيران بيقول لي احنا we are going to the supermarket, can we bring your shopping? In other words, we don't want you to go every day, and also when you go also please call us so that also you can bring our shopping. Those things حتى في ايشيا هنا موجوده في السودان. This is the end of my talk. I hope I didn't talk too much. I didn't also preempt some of Ezzan points. Thank you, Amin, and everybody.
Thank you very much, Dr. Eisa Hamid, for this comprehensive, brilliant, beautiful presentation highlighting all the issues with learned lesson with COVID-19 and the way we have to go forward. It was really good that you compared different models and what really worked and why, and what really didn't work and why. I learned a lot from what you presented, and especially when you were speaking about Asia. I hope everyone is hearing me, is it? Dr. Eisa, can you hear me?
Yes, yeah. I can hear you.
The Asian model has been brilliant. I think literally what I can call it, this is a smart quarantine, what they did, or the smart tracking and the smart lockdown. Just kind of here in Europe, it was unsustainable to lock down the whole community for that length of time. They have to loosen things towards the end because the economy wouldn't be able to withstand the lockdown for 6 months or so. So I think that's why the Asian model was more successful, because they managed to do it in a smart way. So you can't close the whole community, but you do a selective closure or selective lockdown. The other point, do you think, Dr. Eisa, that the type of legal issues and laws and aspects between Europe, America, and Asia, as compared to Asia, did play a role in that? By that I mean, in Asia, I think the government has a higher say in forcing people to install apps, to be tracked, as opposed to the freedom of these things in Europe and America, and the need to get a consent from every citizen in order to do that. And still today, even here in Ireland and the rest of Europe, it's optional to install the COVID-19 tracking app. Do you think that that played a role in this? Sorry.
Okay, I wasn't able to unmute myself. Can you hear me?
Yes, I can.
I think the important thing I was saying here is that there was no complete lockdown in many of the Asian countries, and particularly from the shining example I have seen, even in China, they said apart from Wuhan, which was locked for around 3 months plus. So this is the most important lesson we have to highlight here. There wasn't. And Taiwan is a democracy, India is a democracy, many of the Asian countries actually are democracies, and they have very strong civil society, and of course they have a lot of objection. What is, of course, is different in some of the countries, those experience with the government, with the authorities help to some degree. But my own thinking is that the people are sensitized here because of the past epidemics. They have seen a couple of very bad SARS in, for example, Taiwan, where it was more than 150,000 cases of SARS. And of course, China themselves in 2003. And those decades helped them to be really ready. I think the preparedness was much, much important. Of course, I'm not advocating for smart surveillance for people, but what we need is, particularly for Western government, those political commitments, centralizing the response, and massive increasing the testing. And of course, those MPIs that I have mentioned, the non-pharmaceutical intervention in terms of workplace closure, school closure, and banning of gathering. If you ban a gathering of 10 people or more, the effect is the same as if you ban 100. Canceling those big events, then everybody could move around. I'm here, I'm now in Myanmar, we have around 1,000 cases per day. My son and I, we just out. We are in mask, we grab our coffee, we sat somewhere, next to us there is a cross, nobody sits, and we come back. So there is no, but we are all conscious that we have to keep social distancing. We have the facility of hygiene everywhere. These are the important thing that I think Europe has relaxed a little bit. I mean, you don't have to do surveillance, of course, and there were consent even in China for the population to download those apps, because it gives them option to move around. So of course, quote unquote, if you don't download, you don't move, but if you download, you move. So yeah, so I think it helped to some degree in China, those surveillance. What it needs for Europe to look at the governance, to look at those societal response, and to look at what measure work. If you just close those 6 workplaces, you could have a smart workplace. In Sudan, we could try, we could not. You close your school, you could have online school, banning public. I think UK government, for example, may not do lockdown. Lockdown is needed sometimes. It's really, if you have an epidemic and a cluster of epidemic, you have to lock down, but you have to test. You can't lock forever, and you have to quarantine.
Sure. Thank you very much. Please, for anyone who has a question for Dr. Eisa, you can raise your hand and I'll be unmuting you. We got some written questions here from Dr. Mohammed Khojali. Regarding schooling, is there any plan or advice to save the academic year?
In Sudan, yeah, Muhammad, marhabek, Muhammad Sadiq. In Sudan, you mean, or elsewhere?
I think I might.
Yes, so in Sudan, unfortunately, just to speak about Sudan, I think, yeah, the school has been closed for too long, even after the epidemics went down. And I don't know, I've been away for too long also. I don't know when the school year starts. So really, people suffer. And of course, we don't have capacities to go online. And I think the decision here, particularly the decision for school closing, should be left for government, for Jazeera, for the state government to decide. And even if you decided to open the school, I think there should be some measure for social distancing. Our classes are packed. This has to be really looked at. So yeah, I really don't know. I'm not recommending lockdown in Sudan. Now we have only 30 cases. We don't know how we're gonna play. What we need to focus on is on the response preparedness. We have to have the plan. We have to have the capacity for testing. We have to have the quarantine from now, quarantining those people, let people moving around for some time now until at least we have some evidence that there is a transmission going on. Without testing, we cannot know.
That's great. Yeah, Mohammed said he's asking particularly about Sudan.
Yes, I wouldn't recommend closer. I'm outside Sudan, but I would not recommend for now. It's too early. If we can save 2 months of schooling from now, then you close. It's still better than closing now.
Okay. دكتور الطيب المبارك الخبير.
السلام عليكم ورحمة الله وبركاته.
تفضل دكتور الخبير.
السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
Thank you very much, brothers, for this nice presentation. I came late, but I just want to ask a quick question. As you know, there is a lot of debate now about the coronavirus, and Dr. Dolores Cahill in Ireland is leading a campaign to say that there is no need for the lockdowns for all these measures. I want you, Doctor, to comment on this if you don't mind in a few minutes. As you know, there are some people saying that now we're doing lockdown, we're doing all these measures. A lot of people are counteracting this and they want to stop this. So please, and I would like to thank you. And also I have been to a quick visit. My sister was sick in Egypt. I have to do corona tests for them to go back to Sudan. Wallahi al-Azim, Dr. Eisa. It was the situation that you do the corona test to go back to Sudan, you'll catch a corona yourself. There was a big queues. There was a big numbers waiting outside. They all say you are wearing mask, but their nose in their each nose in nose, hand in hand, shoulder in shoulder. No social distancing. So I think also you are working as epidemiologist. I think you should give. There's two options. Either the country should stop doing testing and they should advise people to make the quarantine when they arrive, because the way they do this thing itself is very hazardous for the people. Thank you very much. Assalamu alaikum.
So, Dr. Khabir Mahabek, for Ireland, of course, it's too late. In such situation, there is need lockdown for some areas. And I don't know, Ireland went very early because they learned the lesson. I look at the data because I mean, the host is from Ireland, the union, and I say, okay, let me see what the Irish, and they were very fast on that. So there is need. And of course, unless you are having ability to test and quarantine as many people, and there is compliance, I think now Europe has reached a point where they have to opt for lockdown and stay homes. But the lesson learned that you have to put those things measures together. School closure, workplace closure, banning public gathering, do all those places, do all those things in areas that now you don't have coronaviruses. Where you have high numbers, you have to lock down. And even in Asia here, there are places where they locked the entire, and then they test, and then they quarantine, and then they isolate. So, and I'll talk, of course, about Taiwan, even those who are negative, and if you are in contact, you have to stay home. So yeah, so it's yes, it's inevitable. Without testing, the situation in Egypt or in Sudan, we will have those. We'll have those situations where you have a centralized lab, everybody tests in the same lab. And now we have options. I think if you don't expand testing, you can even make an appointment system. Here they make an appointment, people traveling. Myanmar have 1,000 cases, more than 50,000 cases in total now. And flights are happening, people are coming in. When my family came in, they have to go under quarantine. But everybody has an appointment system, because in no time, those countries here, they established more than 15, 16 labs for testing with sample transport. So in Egypt or in Sudan, we have to to expand. Now we have some oddities. Myanmar, initially they used a Chinese approved oddities. We don't have to wait for all those FDA approvals. We have to have our own quality control, and we use those not for diagnosis, but at least if you are negative, you are likely to be 60%. Sorry, the sensitivity was 60%, so likely 40% you were negative and you were missed. But at least those tests help people to make decisions. Together with masking, then you could be traveling. So we have to increase testing capacities for the general public. People here test. They do test, even if they have a flu sign, they go and they test. And the country have test capacities with RDTs. Korea manufacture a lot of RDTs. People should buy, government should buy, they are very cheap and you could buy millions of them.
ألف شكر دكتور عيسى. ما أفتكر في أسئلة ثانية، وبننتقل طوالي لدكتور زميلي ودفعتي وصديقي الطبيب والأديب دكتور إزان سعيد. دكتور عيسى لو وقفت الشيرنج للبرزنتيشن بتاعك عشان عايزين نعمل شيرنج.
السلام عليكم ورحمة الله. Can you hear me?
We can hear you clearly. Just if you can share your PowerPoint.
Thank you so much for this opportunity. الأخ صديق أمين من نقابة أيرلندا، وسعيد أكون معكم ومع الصديق وسينيورنا عيسى، وواحد من الناس اللي أضاءوا لنا الطريق في مجال الصحة العامة وكده. أضاءوا لنا هذا الطريق رغم قلة السالكين في ذلك الوقت. وشكرا إنه على هذه الاستضافة، وأتمنى إنه يكون يعني البرزنتيشن مفيد بالنسبة لكم. ما أعتقد معانا ناس نون أرابيك سبيكر، لكن زي ما عمل عيسى هيكون البرزنتيشن ميكست عربي وإنجليزي.
ممتاز.
كده واضح يا أمين؟ ظاهر؟
It's just starting to share now.
Okay.
Yeah, and if you can just, yeah, that's beautiful. That's perfect.
So my presentation will be focusing on the timeline of events that happened in Sudan since the first case of even before the first case of COVID-19 in Sudan, and then I will comment along this timeline. So timeline of COVID-19 in Sudan, what went wrong? Why? What went wrong, and how can we improve our response in the future? Okay, when COVID-19 pandemic started, the Federal Minister of Health began to screen passengers arriving in Sudan through different ports and to gather their information. This was a good step, in my opinion, but not inclusive. Not everyone was, the information was not collected from everyone. There were exceptions, and unfortunately الواسطة والحاجات دي في ناس دخلوا ساي وفي ناس دخلوا عن طريق ports that are not like صالة قبال الزوار وغيره. Early March, the ruling cabinet of ministers and sovereign council formed the High Committee for Health Emergencies to coordinate the government and governmental efforts for combating COVID-19. The formation was early. That was a very good step. Actually, the government acted fast. They formed this High Committee, but we'll see why I put but there. The committee is made of members from ministries of health, labor and social welfare, foreign affairs, internal affairs, information, finance, as well as the head of Central Bank of Sudan. جابوا عشان يدي الناس قروشهم اداهم and representatives of the army, police and the security services. Good representation. يعني the concept was good to involve all those people from different sectors, but some members يقولوا تمام متجرتك اصلا ما كان في لهم داعي ولا جدوا ولا جابوا الحجار. زي ما حنشوف بعد شويه. All COVID-19 related measures and responses lie with the committee. يعني الكوميتي ده التاسك بتاعه انه اي حاجه عندها علاقه بالكوفيد 19 هي lie in the committee. يعني الكوميتي بترأس كل الوزارات اللي عندها علاقه. الوزارات اللي عندها علاقه مباشره direct role in the response of COVID-19 response طبعا وزارة الصحة and the Ministry of Social Welfare. This committee supervises all these ministries, and its decisions are usually based on advice and information provided by the Minister of Health. The problem is that this is the but. This is the but. I explained the but here. Due to his continuous dispute with them, there was famous fight between the Minister of Health. Unfortunately, I have to go to some politics in my presentation, but they are important to explain why we had failures in our response regarding COVID-19. لأنه التنازع السياسي اللي حصل أنا I'm not trying to be in this side or the other, لكن التنازع السياسي اللي حصل أثر على الريسبونس زي ما هنشوف later in my presentation. Due to his continuous dispute with them, he barely attended the meetings. He had a big fight with one of the sovereign council members اللي هو رئيس اللجنة he just took off. He didn't come again to attend the meetings. And unfortunately, the committee had to make very serious decisions in the absence of the representation of the Ministry of Health. On March, timeline ماشيين في timeline. On March, the government started to tighten the procedure for entry to Sudan from affected countries. It was too late because by that time a lot of people came, and it wasn't reinforced enough. زي ما قلنا يعني they were exception. They were people who belong like to the government and some military forces. They entered without being screened or without being investigated. The Ministry of Health sent teams to monitor ports of entries from neighboring countries and tried to provide necessary equipment for the isolation centers on the state. As you can see, always the concept was good, but the problem was the implementation of the concept. Already, the team that were sent to Wadi Halfa and the other ports like Port Sudan and the south, they were very few with very few equipment. And the centers themselves were not, I saw pictures of those centers, they were not well rehabilitated. They were not able to occupy those people. You send people to far away cities like Wadi Halfa, and you don't provide them with a place to stay. You don't provide them with latrines. You don't provide them with bathrooms. And in Wadi Halfa, for example, the quarantine center, which was established, I think by the British, because Wadi Halfa is a port from that time. Very nice building, well built, was donated by one of the walis. زمان الانقاذ واحد من الولاة قام شالوا اداه جهه حكوميه اخرى غير وزاره الصحه كده بس فنجر منه ساي شالوا قال ده والله ناس نشيله من وزاره الصحه نديه وزاره ثانيه. there is a legal fight between وزاره الصحه and this other governmental entity to get this center back. It also the Ministry of Health started monitoring the situation of Sudanese living abroad, especially those in countries that have recorded cases of coronavirus. Not all of these countries were monitored. بعد يوم من اليوم بتاع tightening the procedures وكده on the 13 ظهر عندنا the first case of infection and death. The guy died hours in the hospital, and 2 days later the government announced the closure of schools and universities. On the 16th, 3 days later, the Security and Defense Council in Sudan announced the state of health emergencies. Please observe here now you can see that we have more than 2 or 3 governments in Sudan. The decisions regarding the COVID-19 response were taken by the Ministry of Health, the High Committee of Health and Emergencies, the Security and Defense Council. So it is trying to take control of the thing. And now the state of health emergency with the government closing airports, land and sea borders except for flights carrying technical and humanitarian support and pre-scheduled flights. Exceptions were made like students from Wuhan. This was actually, I think, in my opinion, the students who came from Emirates, from Wuhan through Emirates, and they protested in the airport, and eventually under the pressure, the former Minister of Health allowed them to the country without being quarantined or tested. I think this is one of the big mistakes in the timeline of COVID response in Sudan, because immediately, maybe a couple of days after they got into the country, some of them started to test positive. And they had a lot of contacts, of course, in the airport, their families, the people who came, الناس اللي بيجاملوا والاجاويد اللي جو المطار عشان يحنسوا ناس الحكومه يدخلون، وهكذا. كميه من الناس كانوا مخالطين وكميه من الناس infected. This is the first big I think this is how the community transmission in Sudan started. The Federal Minister of Health بعد ذاك allocated several buildings in Khartoum اللي هم أعتقد معظمكم بيكونوا عارفينهم. الدمان تاور, Universal Hospital in Khartoum North, Khartoum Bahri, and several other state capitals to quarantine people coming from affected countries, especially those returning from Egypt by road. لو بتتذكروا. The quarantine centers were not enough, were not well prepared. في إخواننا, also one of our problems is the centralized government in Sudan. Everyone thinks that Sudan is Khartoum. خلاص يعني هنا مشوا الناس لقوا the nice building of الضمان, the nice building of Universal Hospital, and they totally forgot about the states. Yeah, theoretically, all the states allocated buildings to be quarantine centers. Like those buildings, they are just buildings, and sometimes they don't have electricity, they don't have water, running water, so it is just like قد من وشك. And later they were even the ones that we had, later they were overwhelmed by the high number of cases. We didn't expect that we will go to that extent in the number of cases. The quarantine was intended for those came from affected countries. This measure was not effective as many of those quarantined did not comply. معظمهم شردوا. يعني في ناس كتار جدا ما they didn't even they refused to be quarantined. And as you remember, large number of people estimated have either escaped quarantine or refused to be quarantined. For instance, الجماعة شردوا من الباصات. أول ما الباصات وقفت وهم كانوا موديننا على يونيفرسال جايين من مصر، نزلوا من الباصات وشردوا دقشوا يعني اللي اتدسله في بيت وكده. يعني even more contact، يعني مخالطة زيادة للناس اللي أصلا هم suspected to be infected and they were supposed to be quarantined. The Ministry of Health complained of low rate of follow-up of the people who entered Sudan, since some of them provided false numbers. As you remember, the government, actually this started very good. And we're proud at that time of this measure. The measure of providing a screening form inside the planes for people who are returning to Sudan or who are coming to Sudan. And the problem is, as usual, the implementation first started okay, then the system collapsed. Why? Because two reasons. Most of the Sudanese people, not the foreigners, the Sudanese people who came and gave their information, they put false phone numbers. I don't know why. This is very strange. Why do you do something like that? Yani, what are you escaping from? What if someone calls you and asks you if you have symptoms? What harms you in that? The foreigners comply, and the center, the calling center, the Federal Minister of Health, they were calling people every day and asking them if they have symptoms or not. The problem is then the system collapsed because the system was not able to cope, because the people who were calling, the volunteers that were recruited by the Ministry of Health were limited. The phone lines were limited. There was also for example, one of the examples that the hotline for the Federal Minister, State Minister of Health, or Federal, we had two hotlines, one for the Federal and one for the State Minister of Health, were actually disconnected because the bill was not paid, and it was the company didn't reconnect the line till the government paid the bill. This is a shame on the company and a shame on the people who are supposed to be participating in this response, this national response. Then after the line was reconnected, the number of lines and the number of people, volunteer people calling, were less than the large number of people that were entering the country, and they were supposed to be called. The government also used police to enforce partial curfew. We all know about this curfew. Actually, there was no curfew. The curfew was just everyone was going out. Everyone had a permit, and even when they applied partial curfew, which I don't know why I don't know why it was partial. On the 31st of March, the curfew was extended, and eventually there was a good gesture from the government. They gave all governmental employees age 55 and above, and pregnant women and nursing women paid leave until further notice. Some private sector companies followed suit to support their workers. I think also this is one of the things that is strange in Sudan, that the private sector companies have completely different employment laws than the government, and that's why, you know, even some companies, they were asking after the lockdown, that some companies were asking their, especially the laborers, were asking them to come to work. And the Minister of Labor, you all know about the curfew. Everyone had a permit, and you go out in Sudan and you wonder who was actually under lockdown, because everyone is in the street drinking coffee, smoking shisha, and so. And everyone had a permit. Some of them actually, some entities were selling the permits for very high amount of money, so you can buy your permit and go around as you like. Then I will get to this point later. The Minister of Labor and Social Welfare. On April 13, the authorities announced the total lockdown in the state of Khartoum, and suspended all gathering, Friday prayers, and so. As of 25th of May, 5 isolation centers were established by the federal and Khartoum state ministries of health to isolate and treat COVID-19 cases. So please look at the number of beds. Khartoum Teaching Hospital, which was actually not operated by the Minister of Health, was operated by an NGO, Save the Children, 110 beds. Jabra Center in Southern Khartoum, 110 beds. Universal Hospital in Khartoum North, 319 beds. And the teacher hospitals, اللي هم برج مستشفى المعلم, 250 beds. Can you imagine all? And when we talk about Khartoum, we usually talk about Sudan, because, you know, the services, the health services and other services are so centralized in Sudan. Even if not for the lockdown, people with COVID-19 cases from the state would have come to Khartoum, because everyone, when they get sick, they come to Khartoum. But look at the number of beds in Khartoum, and you know that later they were overwhelmed by the number of cases, and people started to be admitted in private hospitals, where they were charged a lot of, I don't remember, I think it was 1 million per day or more. No, you put like a deposit of 700 million or something like that. So it was or 50, I don't remember, but it was, at that time, it was very big amount of money. Okay, so now we go to the government strategy. So did we have a strategy? Yes, we had a strategy, but did it work? We will see. In April, the Federal Minister of Health, with support of WHO and other UN agencies, developed a country strategy to confront the pandemic. Include a series of measures such as ensuring country-level coordination, planning and monitoring, setting up surveillance, rapid response team, and case investigation and management, setting up national laboratories for testing, and providing operational support and logistics. It sounds very good. في اي حاجه يعني ده زي ما قال الكتاب، يعني اي حاجه كده نحن المفروض تكومبات كوفيد 19 قاعده في الاستراتيجيه دي. الشيطان في التفاصيل وكمان في التنفيذ. ليه؟ It didn't work. Obviously, it didn't work because later we had the explosion of COVID-19 cases. Although considerable funding, around 47 million, was requested by the UN from donors to apply those measures. طبعا it is well known that the وزارة الصحة كانت مفلسة or didn't have enough money to implement such a strategy that was costed. Yani every activity in this strategy was costed, and the total cost was 47 million. And of course, the federal government was not able to provide $47 million because they have other priorities. I think they 47 million ممكن عادي يعني في عشان ينفقوها في أشياء أخرى، لكن they didn't. So the Federal Minister of Health were depending on the UN agencies. لكن implementation faced with many challenges هنشوفها. Weak, underfunded and fragmented health systems. اخواننا ال 30 سنه الحكموا فيها، يعني الحكم فيها نظام الانقاذ، يعني لو كان في قنبله ذريه ضربت البلد دي احتمال كان تكون ارحم من الحصل، لانه نحن وكأن هنالك عاصفه اصابت البلد دي وحطمت اي شيء موجود. يعني انت اذا انت if you are close to the Minister of Health, you will realize that we don't have I don't want to say we don't have a Minister of Health, but we don't have a system. We don't have enough policies, procedures, guidelines. يعني المينستري اوف هيلث نموذج للحاصل في السودان والناس كلها قاعده في السهله. في الوقت ذاك when COVID-19 attacked Sudan, we were not ready, not because we were not ready for the COVID-19. We were not ready for anything. As a Minister of Health or other ministries or government or system, system that controls everything in the country, we don't have. We didn't even have guidelines for the COVID-19. They were developed later, so we were not ready, and we didn't have a health system that can manage or can absorb such crisis. So the health system was weak, underfunded, and fragmented. Till now الناس بتجرب يعني هل تعمل حاجه دي كده ولا تعملها كده، تعمل like this country or that country. لحد زي ما السودان ما عنده دستور لحد الان، ما في policies ثابته. في حاجات كثيره يعني في السودان ما عندها policies وبروسيجر ثابته. اول ما تحصل حاجه الناس to follow policies، وما في اصلا ناس يعني عندها very rapid turnover للستاف. يعني انت تتعب تدرب الناس وتأهلهم وتلقاهم بعد شيء مش السعوديه. Poor infrastructure of health facilities, hospitals, isolation centers and IC units. You all know that. Lack of essential supplies and equipment as well as scarcity of trained and well qualified staff especially outside the capital. قدر الفي قاعدين هنا في الخرطوم. الناس كلها الواحد يعني في الاخر انت اذا بتديه اقل من $10 او $20 كمرتب لازم يمشي برا. Many parts of the country suffer from poor hygiene practice and lack of access to water and improved sanitation service. So some measures were like a luxury to them. انت بتمشي لزول ما لاقي مويه الشراب والله تقول له يا اخي هك غسل يدينك بالمويه والصابون to protect yourself from COVID-19. هو ما لاقي مويه يشرب. He will look يعني think how the way he will think about you. يعني انت كونه يغسل this is a luxury to him. يعني هو ما لاقي مويه يشربها، ما لاقي مويه يشربها، بهايم عطشانه كده. فما ممكن تمشي تقول له والله. انت في البدايه انت محتاج انك انت to have infrastructure, to have يعني basic services للناس حتى ما بدك تطلب منهم to follow the good hygiene practices. Difficulty of getting funds from the donors as the country is not considered the hotspot of COVID-19. القروش اللي طلبوها الدونرز، طلبوها ال agencies من الدونرز were not supplied. ما اعتقد كلها جات. ليه؟ لانه نحن were not at that time they were hotspot for COVID-19 spread compared to other countries. At that time people were worried about other areas like other areas where they had a lot of cases and a lot of deaths, and the community were concerned about those areas. So Sudan was not a hotspot for that. The governmental strategy also complicate. So here معلش يا اخواننا اعذروني انا في السياسه لكن that doesn't mean I'm taking sides لكن I'm just going to present the mere truth. Okay, but that I'm not judging, I'm not saying this person was wrong or that person was wrong. This is merely a fact, and this fact affected the response in Sudan. The implementation of the strategy was also complicated by internal conflict between the Minister of Health and several of his senior staff and health professional body. In very critical time, there was a big conflict inside the Ministry of Health between the minister, the undersecretary, and some of his official staff. And as you know, some of them were fired and some of them resignated in a very critical time that we needed them to coordinate and implement the response. Not only that, there was a conflict between the Minister of Health and the Sovereign Council, Sovereignty Council, مجلس السيادة. تحديدا يعني واحد من رئيس اللجنة الصحية بتاع في مجلس السيادة لدرجة إنه كان في decision were taken by the High Committee for Health and Emergency. The Minister of Health was not involved. So the conflict between the Minister of Health, his opponents, the ministry, the health sectors, some of the, as you know, some of the also health professional bodies, نقابات وكده برضو كانوا against the minister, and the Sovereign Council negatively affected the COVID-19 response. At that time, we needed harmony, we needed coordination, but everyone was singing solo. كل واحد كان شغال بطريقته، كل واحد شغال يعني لدرجة إنه يعني كان في قرارات بتتخذ just to upset the other entity or the other party. When United Force negatively affected the COVID-19 response at a time when united efforts and strong and committed leadership are needed. Okay, now we're going to خلاص أنا قربت شايف يعني شكلي كده أيوة قربت. طيب الحاجة الثانية المهمة جدا اللي أنا كنت عايز أتكلم عنها وعيسى تعرض لها شوية اتعرض عن المسؤولية المجتمعية وإنه المفروض different actors to participate اللي هو actors in COVID-19 response. الحقيقة هي هو يعني everyone was eager يعني COVID-19 جاء in a very nice patriotic atmosphere. الناس بعد الثورة وكل دول عايز يخدم البلد والناس متحمسة وكده، لكن الحماس ده يعني زي ما بقول عساكر الحماس بيغطي على الغلط. فعلا الحماس غطى على الغلط لأنه الريسبونس يعني بقى جبانة هايصة صراحة. بقينا ما أعرف who does what، وزي ما بقولوا اختلط الحابل بالنابل. يعني ما كان في body to coordinate this great efforts. حصل duplication وحصل efforts ما كانت في المكان الصحيح. كمية من الحاجات اتعملت وما كانت يعني had the impact it should have لو كان في more coordination. طيب الاكترز المهمين اللي كانوا هنا منه في الكوفيد ريسبونس، انا بتكلم عن الجفرمنتال لان نون جفرمنتال اكترز، ما بتكلم عن الكوميونتي حاليا. The Ministry of Labor غير Ministry of Health طبعا. The Ministry of Labor and Social Welfare ده الكلام اللي قبل قلت حاجه هرجع له. Identify 600 families in need in Khartoum state, start delivering a basket containing 11 essential food and household items to each of them. دي في زول سمع بها يعني هي كانت a very good initiative. They said during the lockdown the poor families cannot go out and buy stuff, so they provided them with a basket containing رز وصابون, rice, soap, tea, I think sugar, things like that. But I think I don't think it had that a big impact because I don't know if you heard of it. I never seen somebody who got it, and as usual في بعض الباسكت تسربت لجهات ثانيه وهكذا واتباعت وهكذا يعني. واعتقد الكوست ذاته بتاع الديستريبيوشن كان very high cost which impacted actually the delivery service itself. لانه they needed to pay for the police escort و they needed to rent trucks. يعني sometimes you wonder, just like the example I gave about that communication or telecommunication company, which requested the bill for the hotline to be paid before reconnecting it. The same here. Yeah. Why would some initiative like that? Why do they have to rent trucks? وين المسؤولية المجتمعية؟ وين الشركات بتاعت اللي عندها big trucks? They could have donated the trucks for free for this initiative to be successful. Humanitarian Aid Commission, HAC, coordinates NGO offers and facilitate the humanitarian COVID response related activity. The UN agencies, they formed the COVID-19 working group to coordinate their response and provide support to Federal Ministry of Health and implementation the country strategies. And the UN agencies, the problem of the UN agencies with the UN agencies, they come with a certain mandate and they come with certain funding to achieve this mandate. COVID-19 come as an addition. So it was for some UN agencies difficult to allocate budget to combat COVID-19 from a budget that already decided upon from the start of the financial year. International national NGOs, including community-based organizations, their response down, they focus on infection prevention and control, risk communication and community engagement. Was very shy response because of the mandate of the funding, except MSF and Save the Children. Save the Children operated and ran the isolation center in Khartoum Teaching Hospital. It was not operated by the Ministry of Health. Okay, so the elephant in the room, security forces, especially the rapid response forces. It pains me to say إنه ديل هم اللي اشتغلوا، لكن يعني يشتغلوا لأهداف عنده حقتهم هم، ما حبا في sorry, I don't want to go to politics. لكن the rapid response forces were instrumental in Sudan response to the pandemic. Although its image is not good among the population because of their role in كلكم عارفين, the RSF established isolation centers, donated supplies and funds, and supported medical personnel, perhaps in an effort to improve their image. And يعني بجد they did a lot of work, but you know maybe they had their own agenda to do that. Actors in COVID-19, the civil society and private sector. وده ما ده انا بقول عليه وده نقص القادرين على التمام، لانه بجد نحن عندنا هنا راسماليه وطنيه وعندنا companies وشركات وكده. They could have done better. They tried, but it was not enough for the reasons that I'm going to mention. In March, the Sudanese platform for combating coronavirus was formed through an initiative by representatives from the medical field, several engineering companies, groups from the private business sector, and volunteers from local communities, together with community-based organizations. Coalition كده عريض واسع فضفاض، قوامه أو الباك بون حقه اتحاد أصحاب العمل. It was very effective in raising funds, procuring supplies, coordinating between private sector entities that wanted to participate. يعني هم جابوا الناس كلهم كان قاعدين في قاعة الصداقة، مركزهم هناك، أي زول داري يجيب حاجة بيجيبها هناك ويجي. Donation of money, materials and services are directed by the platform to fill the gaps in medicines, equipment, laboratory supplies, PPEs, hand sanitizer and soap. طيب المشكلة شنو معي من الجماعة دي؟ المشكلة إنه يعني نفس الكلام اللي قلنا قبل، the lack of coordination and the lack of one body that supervises all the efforts of actors. بيجي كل زول زي ما أنا كتبت هنا، كل زول يعني كل ناس شغالين براون، والlack of coordination affected very much النوايا الصادقة وكل الفونز اللي اتلمت والسبلايز. اللاك اوف كوردينيشن، دي مهمه كان المفروض تقوم بها وزاره الصحه، لكن وزاره الصحه at that time they were really busy fighting among themselves and بيصدروا في بيانات بيهاجموا each other. And also some of the entities صراحة ده شيء الواحد يقول some of the entities that were working كان إنهم رأي أصلاً في وزارة الصحة إنهم ما عايزين to go through the Minister of Health. Some of them thought that the Minister of Health is still full of previous regime people and those people are not to be trusted with activities related to the response. This is briefly on the timeline and strategy actors in Sudan. I focused on what happened in Sudan specifically, and I hope this was informative and fruitful. And now, if you have questions, I'm ready to take them. Thank you.
Sadiq Al-Aziz, Ezzan, thank you very much for this brilliant, informative, comprehensive presentation regarding the storyline of COVID-19 in Sudan, and what worked and what didn't work, and why at some stage our service were overwhelmed. I can't agree more with that. COVID-19 hit Sudan during a time at which there was a political change, a serious political change after 30 years during which all the public service has been demolished. We didn't have a health service as such, and usually during transitional periods and conflicts, and when politics kicks in, usually this is a time at which you have a trouble. And even here in Europe, when politicians, they were leading the battle against COVID-19 in Italy, we all saw what happened in Italy. It was really bad at the start, and then slowly, when professionals and medics took over, things improved. I think I'll hand over to Dr. Eisa Hamid first to see, does he have any comment on the timeline in Sudan? Dr. Eisa?
Yes, thank you, Amin. Thank you, Ezzan. I mean, Ezzan, this is a situation that we have all monitored, and we can go on and on punishing ourselves, but I think we have an opportunity. We have an opportunity now. I wrote in the comment box that we really need to look at our epidemic preparedness plan for كل الحميات في السودان بما فيها الكوفيد. And that plan comes with a lot of things. We have to revamp a central committee, اللجنة القومية أو المركزية للوبائيات. We have to look at the public health law. We have to start immediately from now thinking, and I think I would recommend banning all those public gatherings, أفراح والweddings والعزاءات شايفينها كلها ماشية. We don't have capacity to expand testing very fast. We have to look at how to do that. And this time, without really engaging the government at Hamdok level, where Hamdok himself chairs the National Committee for Response, Usama cannot solve this alone. So that central committee has to move. I mean, having it, by the way, at the Sovereign Council is not bad at all. I mean, that should be the highest representation, but I was very critical of that from the beginning, because you need to have the executive office. If I'm the Minister for Labor or Minister for any other sectoral ministry, my boss is Hamdok. So if Hamdok is around the table, I would make sure to come, because I would really want to keep my ministry. So that has to be chaired by Hamdok, and I think many people agree to that. And we have to look at the public health law. We have a public health law with no teeth. In public health law, if I am إذا أنا مدير الصحة في المحلية وأعلن هنا الكلام بيصير في ميانمار، وأعلن المحلية هنا باسمها township, the districts, you have the right to confiscate any car on the road. You have that power, and the police follows you. Just bring that car, put these people, take them back home, go test them. I mean, this is not about democracy here. This is a law now. This is a rule of law. People have to know that there is no something, oh, my rights. There is a public law, and the public health law apply like any other law, the rule of law. So I say this before, but I think what is needed now, the health sector itself is weak. We don't have enough number of doctors, nurses, medics. They are not paid. The one that's why we're just talking in the groups about this payment for these registrars and others. This has to be solved. This has to be solved, and I don't know how, but it has to. And of course, there are things could be done, but I think what we needed is a political commitment. So this is the biggest, I think, lesson that I try to avoid as much to touch it here, because all those nice things that we have mentioned, early planning, societal movement, It needs a governance, it needs a leadership. And I put it at the end because without centralizing those response, as we have seen in Spain, in US, in other places, without having a centralized epidemic unit that represented by the highest executive person in the government in this regard, Hamdok or the Prime Minister in other countries, things won't move. So that is my comment here on those things. And yeah, and if we have anything else, it's going to be تموجرتك وزارة العمل في committee, I don't know what committee, والوزير الصحة. At the end, he's the only person responsible there, and they sent for him any person else. But if Hamdok is chairing the central response and preparedness committee, the story going to be different. Even the money from Wazarat al-Maliyah, it will be honored. And of course, then we can tackle the issues of absorbings and low absorption.
I can't agree more with you, Dr. Eisa. I think that was big enough for it to be really chaired by the Prime Minister. Here in Ireland all the time, from day one, every time there is anything about COVID, the Prime Minister comes out in the evening and announces if there is a lockdown and the number of cases, in addition to the other people from the Ministry of Health who are announcing the numbers and stuff. But it's all the time, he's the first person to speak. And I think that reflects even on the society that this is something serious. You have to be careful about it. It's a Prime Minister speaking. I would take your permission just to unmute Dr. Zuhair Al-Fadil. He has a question. I'm just going to unmute him. Zuhair, if you can unmute yourself as well, or accept me unmuting you. Zuhair, كيف الحال?
Assalamu alaikum, Amin. Happy to hear your voice and see you. Ezzan and Eisa, my dear friends. I'm glad to see you here. ما أعرف أتكلم بالعربي ولا بالإنجليزي البلاتفورم بتاعنا ده. You tell me and I will do it.
Mix.
كويس. طيب الحديث ذو شجون كثيرة يعني. I'll try to talk about an experience that I went through with this COVID-19 response in Sudan. It's really heartbreaking. And the amount of enthusiasm and the amount of motivation people had at that time when the COVID hit Sudan was quite high. I don't think we do have that spirit as we speak now, a few months down the line. But the way I see it is there was an awful lot of lack of leadership. A lot of people, a lot of efforts, a lot of resources, a lot of actions, لكن ما كان في leadership to coordinate and to coordinate the efforts and the efforts. That كلام on I think you covered the governmental and the official response in a decent way, and you've highlighted where the defects were. الحاجة اللي أتكلم عنها is the societal response. I came into contact with this through an initiative that we put together, Beledna initiative, and we thought of it in terms of what could the society do in a reasonable way. I don't want to talk about the initiative as such, like it just gives you a hint on what has happened, and our biggest challenges كانت شنو في societal response. المبادرة was designed in a way إنه if you are in a place wherever it is في أي محلية في أي مدينة in the Khartoum state or outside the Khartoum state, إنك أنت how can you protect yourself and your neighbors and your beloved ones where you are, assuming there is no government intervention. Okay. والفكرة كانت is basically about symptomatic identification of cases without testing, quiz, and awareness raising. If you've got symptoms, stay at home. If you stay at home, there would be some sort of community-based volunteers who would identify people on home isolation, and then they support them while they are in isolation. Quiz. The way it operated, we started contacting people in Muqawam, okay? And our contacts كانت one-to-one contact ways. So we come to know لجنة مقاومة في منطقة معينة. We identify them, we contact them, we talk to them. One-to-one coaching كويس. Until you reach a point إنه هم they need to organize themselves. يعملوا لهم لجنة صحية واللجنة الصحية it needs to do this and do this and do that. In terms of awareness raising, يشوفوا الحتات اللي فيها public gatherings, distancing, wearing masks and everything. في very controlled environment is يعني very defined boundaries محلية that they know إنه هم بيتكلموا عن حارة مثلا كويس. It starts from this street to that street. They know their how many households. They know their people. They need to act with them كويس. It was very hectic. وأنا أفتكر إنه societal response كان في a great part of it is lack of information and lack of knowledge. والinterventions اللي كانت advocated بالمنصة القومية لمقاومة الكورونا كانت basically everyone was just doing sanitizers as if the sanitizers is the only thing that would just get us rid of this COVID-19. ما في كان بيتكلم عن interventions إنه أنت the micro environment where people live and go زول بيطلع بيمشي على دكان بيمشي على حلاق بيمشي على حتة بيركب المواصلات كيف بينزل كيف. These are the environments where the transmission occurs. No one was addressing this. So at the first place, what is the advice? Official advice طالع للناس إنه what needs to be done in their current situation, something adapted their situation دي ما كانت available. So it took a lot of time. الحاجة كانت برضو لاحظت لها that was very counterproductive في السبيريت الانثوزيازم والسبيريت بتاعت الانيشيتيفز دي عملت نيش بتاعت competitiveness. الcompetitiveness هي حاجة حميدة كويس لكن بتجيك a feel of إنه I'm doing this to prove that I'm able to do something, yeah. And then if someone else is doing something that is really good, sometimes you feel like, you know what, I'm not helping him. كويس. ففي إحساس بتاع competitiveness ما كانت all the time كانت positive. دي حاجة. الحاجة الثانية 30 يونيو. If you remember the 30th of June كان في very big march. المارش بتاع 30 يونيو دي I think that was the breaking point for the societal response. Up to the 30th of June 2020 كانوا الناس they're taking this COVID-19 business in a bit of caution, okay? الناس طلعت in millions in protests on the 30th of June. They came back, there is no COVID. ده كان أنا أفتكر كان milestone في societal response للحاجة دي يعني. I don't know. The problem is كل الinputs there hasn't improved. يعني when the COVID started entering Sudan in March 2020, the situation هسه is no better than that time. And if the world is facing a second peak, and if the dynamics works in حيكون في second peak في Sudan, and I'm very concerned إنه as much response we had earlier on, we might not have it even this time. In terms of community engagement, ولا in terms of cohesion بتاع الgovernment, ولا in terms of the leadership that is available. So I don't want to spread negative energy, but there has to be a great change for things to go in a different direction. شكرا.
ألف شكر دكتور زهير. I'll pass the microphone to Dr. Eisa and then Dr. Ezzan to comment.
Yes, Zuhair, I was looking at your picture online. I was really smiling because it's been quite a long time. And man, you look the same, really. Yeah, very important here, Zuhair, طبعا, what you have said. And yes, exactly. Really. كويس إنه الصلع من زمان برد بس محافظة. So yes, let's think about what are the opportunities. I think there are opportunities for many reasons. I spend a lot of my time working in epidemics control, particularly malaria, and up to now, by the way. But what we have learned from that, and there's a lot of money from malaria. Osama is also أخونا الوكيل, and with Latino, there's a lot of role of malaria. What we have learned and this opportunity is that without controlling COVID now and controlling all epidemic school al-Hamiyat, we cannot control malaria. Let it put that way. If we cannot in Sudan control COVID, we cannot control malaria. And if we cannot control malaria, we have a serious problem in Sudan. So by doing so here, the program حقنا is able to reallocate some of the monies that is available from those global programs. Sudan is beneficiary of that. لمكافحة الكوفيد والملاريا مع بعض. This is one big lesson learned. Global Fund has 13 million US dollar. They were insisting on ministries of health that it must be used only for HIV, TB, malaria. Now the Global Fund is championing health security. They put around 4 billion for COVID. This country where I'm working from here, and we have to look at how to strengthen the health sector by looking at those even global commitments. The government commitment is modest in every country. Myanmar is similar to Sudan in terms of economic, politics, divisiveness, all those things. Tomorrow is the election here actually. They were able in 3 months to establish 100 ICU unit, fully equipped, training them, running them from international support because they were having the plan ready. At that time, they have only 3 cases like Sudan. And now it paid off when now they have 50,000 cases in total and 1,400 per month. So those plans for us have to be ready. So we have opportunity to get money. We have to have both societal and governmental response. مبادرة بلدنا، المبادرة المشتركة الشيرتها أنا 6 مبادرات دي مجموعة واحدة فقط. المبادرة المشتركة دي مجموعة واحدة من عدة civil society قدروا عملوا 6 مبادرات يعني help a lot. وتكلمت أنا عن المنظمة حقتنا في البلد. The competitiveness comes when certain people in government prefer certain organization. They don't prefer Bledna, they prefer others, or they prefer Bledna. I think we have to have a forum where all the civil society also are seen as one. Here, for example, احنا شغالين مع 50 organization 50 منظمة يعني كانوا كلهم شغالين ملاريا الآن كلهم تحولوا لكوفيد. Just imagine أنه 50 how many sessions they would do, how many villages they would cover, how many. I just look at the report. They cover 33,000 village. ما مدينة ما قرية. Sorry, ما مدينة ما حي. 33,000 village with awareness, with hand sanitizers, with mask. This is a free transportation for you. المنظمات دي تمسك وزارة الصحة وهي يدوا المعينات، هي المترحلة، هي اللي بتعمل لها ريبورتينج، هي اللي بتعمل لها كل الحاجات دي. زمان في السودان احنا اشتغلنا في الملاريا، واحد من المشاكل اللي كان واجهتنا في انه كيف نحن نقدر تتاكل some of government issues. وجاء ريبورت انه يا اخي والله في معمل في كسلة بيستخدم الجمسة وبيشيلوها من الوزارة. احنا زمان ده كنا دايرين نتخلص دايرين نتخلص من واحدة من الصبغ ديل وتستخدم الجمسة ستين. قلت لهم اوكي اذا هو سرقها احنا لا عاوزين الناس السوق ديل يسرقوا الحياة الكويسة دي. ف one of the things that, for example, if you have all those civil society, they can make masks very cheap. ما في زول حيسرق الحاجات دي لأنها متوفرة في كل حتة، حيتوزع في كل حتة. Anyway, we have to embrace that. وده ما بيجي إلا ما لما إحنا to revamp أخونا أسامة to revamp public health law على مستوى المركزي، واللجنة دي يكون رئيسها حمدوك وقراراتها تمشي. وأنا أفتكر there is a lot of money outside there it can be tapped if really we have a leadership and Hamdok at the head of those committees, because I can tell you الأولى they will do something. But الآن إذا إحنا فصلنا الكورونا as a public health problem we cannot get. حتى الآن النواب ما لاقين مرتباتهم. I don't know what is the reason, but because public health it's not important as paying other sectors, as Ezzan said. So I'm not negative. I think we have opportunities to combine both global opportunities and local, but we need to have plans. We need to have plans to say how much we need. We have to incentivize people. We have to provide food and lunch and think for the community workers the most on the ground.
شكرا دكتور عيسى. Just one question before I move over to Ezzan. do you think, I'm going just to unmute you again. Do you think, because when you were talking about Taiwan early on, you were talking about financial fines, they were being penalized if they don't comply with the quarantine guidelines. What Zuhair was speaking about is even the society, the community in Sudan, and what Ezzan was saying about that people, although there was a lockdown, they were still moving. Everyone was buying his permit to go out. If you don't have the motivation, if you don't have the initiative from the community itself, is the solution here just to put really hard rules with legal fines and take things the legal way?
Yes, we have to do that. I mean, these things always work in packages. I remember when I said في نقطة الخليج أنه we can imprison people for locking. وحتى واحدة سألتني في الجروب أنه في الواتساب أنه how many people you could imprison? We need to imprison one person, then everybody will take it serious. And this must happen. Public health law is a law, and law has to be enforced. It has nothing to do with your democratic right. This is a law. If you broke the law, you need to be enforced. Of course, the government of Taiwan also provided social support. They provide meal for the people who are quarantined. They provide grocery shopping for those who they asked to be staying home. So those things goes hand in hand. But in Sudan, just tell me who has been jailed for just breaking any health law? Nobody. They need to be. When we work in the malaria at one point, when I was working in the central malaria in Sudan, in federal malaria, one of our employees, we have this initiative of dry Khartoum one day. And مشى ولقى الصحة الخضراء كلها مليانة. بنروح you have to open بلاغ على المحلية هنا. You have to open بلاغ على المحلية. الزمن ده كان أظن يوسف عبد الفتاح ولا مين وكده. And the fine is 700,000. It was a big dispute. We could all lose our job, but public health is a law. We can't be having a public health without a teeth. And we have to have with the Ministry of Justice to have نيابة الصحة العامة, fast tracking those cases. And of course, they are responsibilities الآن مع عندنا إحنا 7-8 ولاة مدنيين. I think that they're willing to listen and we should work with them. So this is another opportunity to hear Al-Fadil. The timing at that time also, most of the local governors, they were not civilian governors. So now we have some people who are really sensitized. I think what Ayman doing in Khartoum, and I don't care about Ayman or another person, but what he's doing in Khartoum when he come, doing all those public health campaign and cleaning and hygiene is very important. What we have seen من الوالية في النهر النيل وفي الشمالية is quite good. So we have opportunities and we could do something now.
Okay. Over to you, Ezzan.
Thank you, Zuhair. I think the society role in fighting or combating COVID-19 was missed in Sudan. Really, the initiative that Zuhair talked about was really good. The problem is it was not backed by any governmental commitment or any no one from the people who the decision makers picked it up and adopted it. Yeah. Our big problem in Sudan that health is not a priority. Since day one, I think in Sudan, since I think during the 30 years of Inqaz regime, I think the only doctor who was appointed the Minister of Health was Ahmed Bilal Usman. He was a politician more than a doctor. So health is not a priority. Spending on health is not enough. So we missed a lot of opportunities when the COVID-19 hit. One of the missed opportunities is the momentum that we had. So Zuhair talked about a very good society initiative, and we had the momentum to implement it because people were so enthusiastic about contributing in building their country.
I think we can learn something from the American election. We can always get back the momentum. We can always get the people back, and I don't want us to fear that. People are very smart in Sudan. People really, الشعب السوداني ده شعب واعي جدا جدا, and they observe. They are very modest because they don't tell you that they disagree with you, but they know who does good work. And I think there is level of frustration, of course. They have seen that.
Yeah,
But
yeah. Well,
in
yeah, but
public
at
health,
that time, the momentum,
Yeah.
so at that time, the momentum, if it was used by the leadership, the country leadership at that time, they could have achieved a lot of results, especially
Yes.
from at the youth level.
Yes.
This reminds me of بيت الشعر ويعاجز الرأي مذياع لفرصته. وكان وايضا ولم ارى في عيوب الناس عيبا كنقص القادرين على التمام. At that time, if those youth with this momentum and this enthusiasm were adopted by the country leadership, they could have achieved a lot of things in the COVID-19 response, and they could have achieved that things that remained as assets to fight other pandemics in the future. They could have established systems. They could have established non-government society-based organizations. They could have established a lot of things, like they could have rehabilitated buildings and things like that that could have stayed as assets to fight other pandemics in the future and to save the people in other health issues like primary health care and so. Also, one of the missed opportunities are the funding that came to the country at that time, and this funding could have used to establish infrastructure to rehabilitate centers, to rehabilitate hospitals,
Yes.
to
Yeah.
procure equipment, and
Yeah.
this could have stayed to serve the health needs of the people. Whether there is a COVID-19 or not, this is also a missed opportunity, I think. Over to you, Eisa.
Yes. 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 No, we have to. I mean, the government here was so smart where I am here now. They had 3 cases and they put a plan of 17 million, yes, 17 million. And they were able to do those. Now the plan moved to 200 million. They were so articulate. I think we could articulate that. I just showed the map where we are surrounded by those countries have tens of hundreds of thousands of cases. Egypt, الخبير اللي بشوي يتكلم عنها, Ethiopia more than 100,000, and the Gulf and all those 3K. The MENA region, by the way, now the daily cases are 30,000 cases. That is the Middle East region, that way we are linked to. And at the highest, it was 20. So basically, and this is in 2 weeks only. So in 2 weeks, we moved from 20 to 30,000 cases. This is very strong justification now for us to convince Hamdok, to convince international donors that quickly we need things. Payment for government, for everything. Here, the plans has to come first. And now, I really recommend وزارة الصحة في أنها to put a quick emergency plan with all those what they need, actually what they wish for, big one, and they sell it as if it is an urgent need.
Picasso is raising his hand.
Last thing before, just to add more to Isa's comment about the political commitment. This is really important. You know, people regard Minister of Health كوزارة مسكينة, عشان كده يعني بيرضوا بها الناس, يعني يعمل اتفاقية السلام وكده بدو وزارة الصحة زي كأنها this is not that important. People should recognize the importance of the Minister of Health. It should be وزارة سيادية زي الوزارات السيادية الثانية, لأنه الآن إذا country affected by the gate of the health, ما تقول ثاني ذات سيادة الكنتري, عشان انت يعني الآن الأهمية بتاعت الصحة ظهرت وتقدمت على أهمية الميليتري وكل حاجة ثانية شايفينها الناس مهمة. وunfortunately يعني الباور doesn't lie مع ما عارف اقول شو, ما اقدر اخش في السياسه تاعي, لكن ما يسمى بالشق المدني في الجفرمنت doesn't have enough power to execute things, to achieve things. أنا قبل كده in a meeting in the Minister of Health, they were looking for cars or something to be used to execute a campaign during the COVID-19 response. And I said it pains me to say it, but the one entity that is going to do this immediately and efficiently is the RSF. تمشوا لحميدتي هيعمل لكم الحاجة دي immediately, efficiently and timely, unfortunately. So that tells you where the power to do things lie in this government.
Yeah, Dr. Amin and Ezzan, I think on everybody here really for staying for this long. But I think now we have a ground to advocate for health. I mean, peace has been signed, peace agreement has been signed. There is no hostilities. I just show in the slide that there was a joint initiative even with Kauda. Now people within Abdulaziz Al-Hilo, Akhuna Abdul Wahid, Mahab Noor, they're all willing to work when there is problem of health. So there is no hostilities. So there is no excuse now. What we need is a big social campaign من كل العاملين في القطاع الصحي وكل المواطنين لأن الورشة دي على الفيسبوك في أنه نحن من الأسبوع ده to talk about health. Our health is our problem. The same way we are highlighting peace, everybody was following what's happening in Juba, and محتاج أنه نوجه الطاقات دي والحديث والadvocacy towards وزارة الصحة والوزارة الصحة في كل ولاية والولاء. We must have a health policy in Sudan. We are working شغل اليوم باليوم. COVID come, حماية الشمالية جات. We have to have a health policy. Do we have a right as a nation هنا to have a universal health coverage, mandatory insurance for everybody, free health care? We don't know which option the government is taking. Everybody بيتكلم عن السياسة الاقتصادية. تحرير وما التحرير والناس منقسمين على اثنين، انت مع الدعم ولا ضد الدعم. نحن عاوزين الان الديالوج ينتقل الان للصحة. انت مع التأمين الشامل ولا مع التأمين الشامل؟ انت مع مجانية العلاج ولا مع مجانية العلاج؟ انت مع universal health coverage ولا انت مع انت مع وزارة الصحة الاتحادية تكون هي المسؤولة عن كل الابيديمكس. اول ما يعلنوا في ابيديمكس ثاني الاوالي يمسك الوزير يمسك وزارة الصحة ولا محلية. الزول من الخرطوم ده يضرب تلفون to command, center of command, information flow, direction flows. Of course, implementation always will happen at the ground. Do we need that one? Federal agency for epidemic preparedness, or we need scattered? Khartoum is politically linked. There is response. Next door, Shamalia doesn't have CBC. This is not acceptable. And this is not acceptable because health has not got that value to be the same as issues of peace and security, as Ezzan said. It has to be a piece of security for us in Sudan health. It has to be an economic agenda. At the economic conference, there was no presentation on health economics in Sudan health financing. There wasn't there. Akhuna Usam Masha, to advocate for health, but he was not invited to present papers. There was no discussion in the Mu'tamar al-Iqtisadi. Health was not represented. There was no section. I asked the organizers, do we have a complete separate section about health? No, it wasn't there. Immediately بعد ذاك حماية الشمالية جاء. So that means the economic forum was a failure because they never saw that the حمى الوادي المتصدع or Rift Valley fever affects human and animals, and then the whole ولاية الشمالية was economically crippled. الموسم الشتوي كان مهدد بسبب الحميات لأن everybody was sick. So people will miss the whole season, and then the following season after الحميات المجاعة لأنه we lost the season. So what we need is a now how to raise the profile of health to become, and this is not a divisive issues. This is not a political agenda for parties to criticize the government of the day. We are all دي حكومتنا احنا جبناها. الحكومة دي لا تمثل إلا كل الشعب. هذه الحكومة تمثل كل الشعب أيا كان فيها جناح عسكري أو غيره. دي حكومة الثورة. بعد تجي الانتخابات بعد ذلك احنا حنتقسم pro and against. الآن ما في حتى معارضة شرعية. احنا we are all in one boat. Then we need to have that dialogue together.
I can't agree more with you, Dr. Eisa. I think getting the people awareness up to that health is a priority. The health minister is no longer just a present that you give it to one of the military movements just to make someone happy. it's as important, and if it's not more important than the Ministry of Defense or Ministry of Interior Affairs. Here in Ireland, if you stop any Irish citizen in the road and ask him who the Minister of Defense, they don't know even who he is, and I did that before. If you ask anyone in the road who the Minister of Health, straight away they'll say to you, Simon Harris, that's his name, because everyone's priority is his health, and this is the guy who gets most of the revenue in the government that goes to health. This is the guy who's looking after our health. So people awareness and people perception of Ministry of Health should completely change. And I can't agree more with you in terms of setting policies to move forward. Like human being should be at the center of every financial and economic improvement. If you don't have a healthy human being, you don't have any of that. Let me just, I have the two last questions, and so thank you everyone for staying along with us. Picasso iPhone, if you wouldn't mind just accepting to unmute yourself if you have a question.
Okay. السلام عليكم ورحمة الله.
عليكم السلام دكتور محمد حسن الزميل العزيز تفضل.
مساء الخير و thank you the academic office of SDI. Thank you for the speakers, Dr. Ezzan, Dr. Eisa. I was late joining in, but I really enjoyed the talk. And I actually was going to ask a question after Dr. Ezzan's talk, but I think the speakers, Dr. Zuhair, Dr. Ezzan, Dr. Eisa, has touched on it. But anyway, I'll say it anyway. I was following, like many of us, the reaction to COVID in Sudan in the first wave in March, and I could see clearly like there was a lot of work, especially in the media, about the COVID and all these kids songs and ads and all these like instructional guiding ads. So my question was how did you rate, like being in the field and being close to the hotlines, how did you rate the response of the public to all these things? Yes, generally we can say we don't have an information system, but generally, like from talking to people at that time, people were using like family, friends, and things like that. I think people were kind of doing some response, but the general outlook maybe to some extent would be like, no, there is not that great response in adhering to the guidelines and things like that. And now after you've spoken about the opportunities and what can be done, I just think about the days that we were in medical school and we're running those health campaigns here and there, would go to places. I think, as Dr. Eisa has highlighted, the role for, or Dr. Ezzan has highlighted the role for medical leadership is missing, I think, greatly, because maybe there's some societal change, a lot of things has changed in the last decade or so in Sudan. So you can see more civil society organizations taking the lead and maybe affecting the political change as well. But I think the role for the medical profession is still not fully implemented. I think together with what have been said about the political engagement in fighting the COVID. Anyway, this is what I wanted to say, but I would appreciate your comments or answers. Thank you very much.
Thank you very much, Dr. Ahmed Hassan. Dr. Eisa, Dr. Ezzan, over to you.
طبعا دي نقطة مهمة يا أحمد، أنت برضه to measure الكومبلاينس حق الناس through various ways. والصورة بالنسبة لي أنا طبعا من برا السودان كانت ميكس. يعني زي ما قال الدكتور زهير كان في انثوزيازم وكان في سيفل سوسايتي وفي ناس متحركين، والمدى اللي بنشوفها على مستويات كثيره، ودي دلاله عنه في يعني في جنرال اويرنس وابيليتي من الناس انها to comply. But at the same time احنا برضه we have seen انه كان في الاعراس وفي الوفيات وفي كده كان في يعني complete case non compliance من الكوميونتي، وبعد ذلك برضه ما كان الماسك ده يعني ما كانت very well publicized واثر شنو كده. فده برضه شفناه. اوف كورس 30 يونيو والمسيره والبوليتيكال بارتي برضه افتكر انها كانت irresponsible في انها ما تؤدفوكيت في انه المساله دي. طبعا الناس still they can decide and I have shown evidence. Let's talk about science. Big public events has big impact on COVID. So people has to know. حسن نقول الكلام بالعربي. التجمعات الكبيره دي اذا عملت الان دراسات وضح تماما ان هي اسرع طريقه ممكن تنقل لك الكوفيد كويس، وهي اسرع طريقه لو وقفتها بتوقف لك الكوفيد. عشان كده اصلا في الكومنت بوكس قلت لك من الان لازم تبان كل الببليك ايفنتس دي والجزرين من 10 انفار وفوق ناس، وطبعا بعد بيجي مع بعض مع السوشيال ديستنس. فاحنا وي هاف تو نو البوليتيكال بارتي اللي بتدعو للمسيرات والخروج وحق الطرق الصوفيه، شفناها وفاه الشيخ مين المسائل دي الناس انتم عارفينها. التجمعات الكبيره دي يا جماعه هي الفلير اب كل الحميات وبالذات الكوفيد اذا كانت عندنا نزله ولا غيره. فدي ما لما الحكومه تبلاي رول موديل اون وتتعاون مع منظمات المجتمع المدني، الجمعيات، ناس بلدنا والمجتمع المدني، القومه الثوره دي واللجان بتاعت المقاومه دي، الكومبلاينس ما بيجي بسهوله يا جماعه. الكومبلاينس ما بيجي بسهوله. يس it was a mixed. افتكر it was a mixed. but يعني انا اشتغلت يعني في الكلينيكال بسيط جدا جدا. ف I can claim انه انا really work in public health as a front line. You can change behavior very fast. You can change behavior very fast. When I was in Bantu for this vaccination, people don't want to vaccinate their kids for many misconceptions and for many other things that they are busy about. But I realized that يعني وكنت تستمع if you listen about their concern and then you reply back and they listen to you, they change their behavior. In Asia here, I said, after 150,000 in Taiwan, the behavior changed. Bigger for masking, bigger for compliance. But still the government know that without fining people, without punishment, they can't change behavior. So this has to go together. I think we have to apply the rule of law. We have to continue to educate. We have to continue to engage. We have to play the role model من منظمات المجتمع المدني. ويا جماعة الأحزاب دي هي منظمات مجتمع مدني. How المجتمع بينظم نفسه في شكل نقابات، أحزاب، منظمات. الأحزاب هي الناس ما فاهمينها. أحزاب is a civil society organization. They have to play a role in this COVID. يعني المسألة دي مهمة جدا جدا. الشيء العاجل الآن بالنسبة لنا نحن، أنا وريت في الجراف أنه نحن الآن الليلة في نفس المرحلة حق بداية مارش قبل الإبيديميكس. إذا عاوزين نعمل أي حاجة we have to start from now. have to revamp الحاجات من الناس. ف I cannot repeat myself, but أفتكر أنه what we need now is a global advocacy في فيسبوك في واتساب أنه يا جماعة نحن health is a health and security issue. is a peace and security issue. بعد السلام عاوزين الصحة والاقتصاد.
عزام.
شكرا أحمد. الحقيقة ما I have no more to say after Isa's comment. I just wanted to emphasize on the role model thing. إنه أخواننا إذا كان رب البيت بيدف ضاربا، ده بالضبط اللي حصل معانا في موضوع الكوفيد. The breach came from the higher level of government. ما not just in في 30 يونيو. طبعا كانت ضربة القاصمة when one of the leaders participated in the march. لكن قبل كده وفاة وزير الدفاع, all the government, high level of government, they went to the airport to receive the body, his body, and they went to the funeral. this is كانت الضربة الأولى لجهود مكافحة الكوفيد, لأنه أخوان الناس على دين ملوكهم. If you think, if you see your leader doing against what he advises you to do, of course he will not do it. The role modeling is very important. The commitment from all level of from the all level of society, the level of leadership, the level of regular people is very important. And I think no one is not willing to change. As Eisa said, behavioral change is very easy, and it can be sustained. When I was in Japan, one day my Japanese professor showed me a video of Japan in the 40s. You cannot believe. I didn't believe. I told him, give me a copy of that video so I can show it to people in Sudan, so I can give them hope one day we'll become like Japan. It shows very dirty roads with animals around people, and a lot of dirty water, a lot of flies, a lot of infectious disease. Now Japan doesn't have infectious disease, as you know. Even even the infectious disease they got rid of because of the good hygiene, and now they don't have flies, they don't have anything. But that video actually gave me hope. One day we can change and we can be like Japan, inshallah.
Yeah, I remember hearing someone saying that and saying, okay, I think one day we can be like Japan, but we have to start the same way. Let's get the nuclear bomb first. I got a question from Dr. Nazim Haider. Dr. Nazim, he's a pioneer and extremely active initiative for health improvement and all over our beloved country, and he's been really active in donations for initiatives all over the country, and especially for the area of Kassala during the different disasters that happened there, and during the COVID time as well. Nazim's question is, he's asking if there is any idea how the international support for COVID-19 in Sudan will be utilized. Is it for increasing bed capacities or test expansion? How ready is Sudan to combat COVID-19 in a second wave? I'll mute you again, Eisa, if you want to start.
The international support, as I said, now they look at COVID as a health security issue. Most of global donors, even those working on a special initiative like combating malaria, TB, HIV, or EPI like البرنامج الموسع للتحصين, they have all incorporated COVID in their plans. Where they have two mechanisms. You can use the current allocation of your global funding for Sudan. بالمناسبة يا جماعة السودان خلال قبل الحكومة دي لقى أكثر من 240 مليون دولار. أنا بقول أهدرت يعني 240 مليون دولار. السودان كان بيلقى سنويا ملايين الدولارات فقط للملاريا. Anyway, هاي الأموال المخصصة لمكافحة الملاريا، الدرنة، التي بي، التطعيم، جزء منها بنسبة محددة ممكن يستخدم للتصدي للكوفيد. الكوفيد عنده لستة بتاعت أشياء أنا حطيتها في السلايد. يعني أنت ممكن تستخدمها في توسيع الكباسيتي حق التستنج، تستخدمها في توسيع الكباسيتيز حق الهوسبيتال انفكشن كنترول، gowns and all those things and stuff for the medical doctors. تستخدمها of course في توسيع الاي سي يوز وحتى توسيع الطوارئ وكده. عندهم now special tracks. Global Fund عنده 4 مليار دولار فند. واحدة من المشاكل الكبيرة انه الدول دي ما وضعت بلان. يعني you don't have plan what you want to do. So we have to have في دعم انترناشونال كبير جدا ما توقف، وفي فرص حتى مزيده، لانه زي ما قلت لك بقى هو health security issues. health security issues معناها شنو؟ معناها الدونرز ذاتهم بيفتكروا انه مكافحه الكوفيد في الدوله الاخرى هو عنده تاثير على دولتهم. يعني European Union this is how they look at COVID. والناس الثانيين برضه الجلوبال بانكس، مثلا البنك الافريقي للتنميه، هنا بنك اسيا، البنك الدولي، يفتكروا انه if you have allowed COVID to become a big pandemic you will have a chaos, unrest وعنف وحتى انقلابات وغيره. فالهيلث سكيورتي يعني منظوره بقى اوسع من الصحه. فقاموا وجهوا جزء من الدعم العالمي الان ده للحاجات دي. I think we have now opportunity to put a different plan, a plan that looks at all the intervention, whether it's at the hospital or at the community, and there will be some funding for it from globally.
Ezzan?
Just now Sudan has presented a proposal to the Global Fund to fund COVID-19 activities, and actually it was approved around maybe $600,000, and this is a great step because now we have fund allocated specifically for fighting COVID-19, and it was actually approved when people thought COVID-19 was gone. So now the second wave is coming, so the funding will come in the right time.
ان شاء الله. اخر سؤال من دكتور هشام الخضر من انجلترا. How does the story of COVID-19 pandemic in Sudan compare to the global story, America, Europe, and the Far East? How does Sudan compare? I think it might be a little bit a bigger question.
It's an important question because we have, apart from COVID, we have other really problems, big problems in health sector. We have a fragmented health sector, as Ezzan said, completely being damaged by negligence. It was actually intentionally also damaged because the health sector has been at the forefront of the resistance. But let's compare. I mean, we're doing very worse, as I said, even with the region. I mean, we shouldn't compare with America. I show the map, and I show that we are surrounded by Ethiopia, who have more than 100,000 cases, despite the limited testing. Egypt, more than 100,000 cases. Libya, more than 60,000 cases. And suddenly, Sudan only have 14,000 cases. So we're doing very worse compared to the region. And it's unbelievable. And of course, if we look at the flight traffic between Sudan and our main economic partner, which is basically Emirates, have more than 300,000 cases, then there is no way that we are only at 14,000 cases. So we're doing very badly in the region, even if we look at the African region. I mean, it's a goodwill that we haven't seen a lot of those cases. And even if we have, we did not test enough to see things. What differ, of course, between those countries or even America, Europe, and others, they have a good health system. They have bad governance for the health system. Which agency is responsible for what? And I talk about the role of centralization and decentralization. Ezzan and I, both of us, we teach health systems. And I look at the Italian health systems. Italian government, before COVID, changed, the whole government changed because of the health system. Italy went through 5-6 reform of the health system because of the debate between central and decentralization. And at the end, they arrived that without having a free healthcare system for every Italian citizen, that was the motto. We cannot have a prosperous Italy. And 20 years ago, they approved a free healthcare system, the tax-based system where all the government has to collect tax and send them, although Italy has a federal system, collect money centrally, and then they'll be allocated according to the regions, and then the regions who are well off, they can put on top of that. Without this, and still when the COVID hit Italy, it was hit very bad. So we are very far from Europe, America, and even the Far East. The success behind Korea, I went to both Koreas, North and South. Same people, they don't even have ethnicity, geographically closer. But both of them actually, and I went to the rural health center in North Korea and South Korea. Both of them, they put health at the economic plan. It's a human right for every Korean person, both North and South. And the Northern Korean health system, the production of health workers, I went to the small health center, they have 6 doctors. And every doctor do house visitation. We are far also from the Far East. Unless health in Sudan become an economic sector, That means any planning has to include health not as a recipient just of tax, but actually investment money to be put into health, just like when you have a capital that you want to grow. So they have to invest in epidemic preparedness, they have to invest on human training, they have to invest in research, not just to provide free healthcare. Unless that happens, we can't compare with those nations. Of course, we have to be modest. We still will have challenges, but I think COVID for us should shift the dialogue towards health. It should be our moment to just cry and frighten government that كل الحميات of COVID is just an example. Oh. And in terms of numbers now, as I said, I look at the daily WHO reported numbers. Sudan now consistently for the last week have 30 cases. The last time we have 30 cases was 2-3 months ago. We have some spikes, but consistently. So that means if you just multiply by 1.5, that means we have more than 30 cases. That means we have maybe 50, 60. And if you just say, okay, everybody in Sudan have 5 family members, then we have 150 contact. And of course, we are not having that list. So the numbers are big. What is needed now is to not to frighten, not to go for lockdown. It's just to do those smart intervention, as I mentioned. Those 6 options that we have presented: school closure, but not now. Public health closure. Sorry, public event cancellation. Stay at home for some of the places where they hit. Looking at the social packages, getting the health sector ready again. Galvanizing the epidemic response by putting Hamdok at the head of the committee for response, and now he has to appear. His Excellency the Prime Minister has to come forward now and address. I haven't seen Hamdok spoke about COVID at all in any public setting. The same way they fly to Juba to address the peace, we need them now to come to Ministry of Health or whatever Manassa to speak about the Humiyat. This is something that we have to demand our government. I mean, we have love for the government and support, but also we have duties to have tough love. This is the time now we all should demand the highest civil servant in Sudan has to come and talk about, to tell us what is the plan. It's not for Osama.
Great. Ezzan?
Okay, thank you, Eisa. Thank you, Hisham. I think I think Eisa answered Hisham's question, and the second question, yes, you are right. The number of cases and deaths are misrepresented with true number. Actually, by far, I think that the number of cases of COVID-19 in Sudan may be triple or more than triple of the declared cases, because, you know, because of the limited testing, of the stigma. This is very important, by the way. The stigma accompanied the infection with COVID-19, kept a lot of people from testing, from getting tested, and from declaring their infection. And also because of the limited facilities that offer testing, also the numbers were misrepresentative, as well as the facilities that some people actually got COVID-19. They were treating themselves at home, and some people actually got COVID-19 and died at home without anyone knowing them. And there was explosion of cases at what point, when a lot of people were complaining of symptoms related to COVID-19 and they were not tested. Most of them were not tested, especially the loss of the sense of smell and taste. So many people were complaining in the society about that, and no one got tested. So the numbers are actually misrepresenting the actual number of cases and deaths due to COVID-19 in Sudan. Moreover, I think what happened in Sudan, I think we still don't understand COVID-19. We need a lot of research to understand why Sudan, in spite of the fact that we don't have a good health system to combat COVID-19, we are not prepared. COVID-19 it's like يعني زي الناس يعني الناس يقصفوا مكان ووجدوا اصلا يعني هو ما في حته يقصفوها. COVID-19 جاء السودان Ghana not prepared. We don't have a health system. We don't have protocols. We don't have infrastructure. We don't have equipment. We don't have staff. But actually behave itself in Sudan. يعني كان مؤدب معانا. When we compare Sudan with the region, and when especially the Arab region, and when you compare Sudan with Egypt, the neighboring Egypt, and when you compare Sudan with Europe, you find that the number of cases compared to those countries and the number of deaths compared to those countries are not that high. Providing the fact that the fact that we don't have anything to combat COVID-19, actually we were very lucky to have this limited number of deaths and cases. Even with counting the numbers that are not officially, even when we imagine that maybe the numbers, the official numbers are tripled or more, or they were far more than the announced cases, you will find that the numbers were not that high when you compare them to the health system and the response that we had. So we were lucky that we didn't have a lot of cases and we didn't have a lot of deaths, because we didn't have anything to combat the infection and combat and to deal with cases that are already infected. We didn't have facilities to offer medical and health services to people. So we need a lot of research to identify why COVID behave differently in different countries.
Yeah, let me be the devil advocate, Ezzan. I know I came across few papers where we're speaking about different types of hemoglobins, which are African in origin, which are in somehow protective, although like it's a weak evidence. But even they're saying areas where it's endemic for malaria, the mortality and morbidity of COVID is not that bad. I can't tell you why, but these are observations, and I came across few papers. But let me be the devil advocate. Like in Europe and in America and everywhere where they did the lockdown, if yourself and Eisa now are saying that this is the right time to act, lockdown is a good thing. If we do a lockdown now, and everywhere where they did the lockdown, it was to flatten the curve in order not to overwhelm the service and the capacity of ICU beds and hospitals. That's available. If you're working in a health system which is like ruined, like in Sudan, where there are no policies, there is no infrastructure. What's the benefit of the lockdown? If you're locking down, you don't have the facilities. So if you lock down or if you don't lock down, what difference are you making? If by that I mean if the curve is halfway or if it peaks, it's the same. You don't have facilities to serve the people. I've been told that the number of ICU beds in the whole country, there's 75 beds. I'm not sure about that number. Is it true or no? But for 41 million, that number is doesn't serve anything. Is lockdown in that setting a good thing? The other part of the question, we've seen what happened. Although the lockdown in Sudan didn't work that well, a lot of people, like what you said, they were not complying with the lockdown at the community level. But even with that, the health service for other conditions apart from COVID, a lot of people, they were dying from myocardial infarctions, from other medical problems apart from COVID, and the mortality from other causes increased because all of a sudden, with the lockdown, the health service, all the hospitals, they closed their doors, even the private sector, which is taking most of the burden. Do you think lockdown again in Sudan is a good idea?
I think maybe Eisa can tell us about if the Asian model can be implemented in Sudan. The social distance.
Yes, I mean we are in a health workshop, and let's confirm the facts. Lockdown and quarantine does work, and the problem is that when we utilize this as a health measure, then it does affect everything else, and the other sectors are not doing their job. So when you lock down, you deny people of economic opportunities. So that is something we have to bear in mind. So now, lockdown save you, save your family, save the health sector. And still, now after all this analysis has been done, there are measures that are as effective as lockdowns. And I think Asian countries have done that. What we need is that, and I still look at the example from Taiwan, where they quarantine around 400,000 people for the freedom of the 23 millions. That's what they have done. So what we need is that when the health authorities say their word, when they test you and you are positive and your contact are traced, whether they're negative or positive, all of them, they need to stay home. In Sudan, that cannot happen without social support. Stay at home or quarantine centers. Government has to be ready to open, I don't know, stadiums and homes and whatever places to quarantine people. The rest of the people, they move around as long as you are doing masking, doing hygiene, doing all those things. So we have to be prepared for quarantining as much as possible. And at one point, locking a complete high or locality. These are the MPI, non-pharmaceutical intervention that is still at play until the vaccines come. And when the vaccine is discovered, we're gonna be at the end of the line because we don't have capacity to deliver the vaccine, even if today, all the doses for the Sudanese people, 40 million is lined up in Khartoum airport by 10 planes coming from international donors. We don't have supply chains, we don't have the storage capacity, we don't have even a cold chain. So people still will be in need of those measures, social distancing, masking, until the vaccines come. I think lockdown is going to be an option in places where a certain threshold is increased, and Minister of Health at all levels need to establish that threshold. We don't have it from here. Minister of Health has to have the power from now on to convince cabinet to cancel all those public events. And the Ministry of Health doesn't have the needed support. There was question and comments. Doesn't have. Ministry of Health at the local and federal level is like an abandoned child by the government family. So they are part of the family, but they are not getting all the care they want. And that can only happen if now health is elevated up in the agenda. COVID for us, we should just use it as kind of the bow, scary things. I think Osama is intelligent, the current acting minister, His Excellency, Acting Minister Osama, when he put the priority of al-humiyat, malaria, COVID, measles, all together. We have now 5-6 epidemics going at the same time, so we should all talk about them together.
Right. Ezzan, do you want to comment on that? I don't think we have more questions. How to implement the change with our culture and society background? I think, Eisa, you spoke already about that early on, about how to implement our culture and society background. Am I correct?
Yes, I recommended in that to look at those 6 interventions that were being studied and the effect range from reducing 3% to 25%, even 60%. School closure, workplace closure, basically قفل المكاتب, banning public event, banning gathering. التجمعات تختلف من المناسبات الكبيرة العامة. And monitoring internal movement بين الولايات and stay at home options. people who مثلا عندهم بعض الأمراض أو بعض الأحياء كل الحي يقعد. These are options. While lockdown is still remaining options. With all this, there must be a lot of awareness in all medias, a lot of compliance, applying the public health rule in terms of punishment, increasing Ministry of Health testing, because also when you test people and you tell them, okay, you are positive, that is change their behavior. And I think at the height of the COVID, people start to realize, oh, this is serious now. They start to stay. And when there was no testing and nobody knows, that also discouraged people. So yeah, And the lockdown outside Khartoum, is it an option, or it's all? Yes, it's an option, but so far the numbers are coming from Khartoum, so we don't know what are those 33 cases that we have seen is coming from Khartoum. So Khartoum needs special care because of the population density, because of many things. But we are not recommending lockdown.
I don't think we have any more questions here. We have a lot of compliments for you, for Dr. Eisa and Dr. Ezzan. I'll give you the chance, Dr. Eisa and Dr. Ezzan, just to say one last word each.
My last word is that we need, as a people of Sudan, as a public health, and also as health in general, is to put that Sudan now has 3 ongoing epidemics: malaria, COVID is coming, and the polio, and we have the non-communicable diseases, which are conditions that will be precipitated by COVID. These things need to be highlighted. This is number 1, that we have those epidemics ongoing. Number 2, health needs to be a health security agenda in Sudan. That means the response has to be headed by the head of the civilian government. We have to see him on media talking about challenge of health, and that we thank him for increasing the health budget, but we have other issues. This is my message. The last message, I really would like to thank the Sudanese doctor in Ireland. It's been quite fruitful to be here, and we are happy to share what we have put in this presentation. Is a contribution, it's not a solution. And I think what we need as doctors is to work on our divisions. We become so divided, and I think our division are not on the issues. There is no single doctor, nurse, or any other health workers disagree that we have a weak health system. So we are agreeing already. We have a fragmented health system. We are agreeing. We have underfunded health system. We are agreeing. We may disagree on the solution, but we can only work together to have any of our solution implemented. So we need to see how to unite. Health should unite us. We should put political division aside. We should put societal divisions, ethnicity, region, Somalia or Sudan, I don't know, epidemics happen here or there, aside. We have to work together for one thing, to have one health for one health system for everybody in Sudan.
Thank you very much, Dr. Eisa, for this golden words. I think, that's a brilliant message of putting everything aside and let's concentrate on health. Forget about politics, forget about different backgrounds. Over to you, Ezzan.
I thank you so much for this opportunity. والحمد لله الكهرباء اتسترت معاكم. طبعا هزول وانا قاعد على اعصابي. وقبل ما جيت جازفت لكم بنزين للجنريتر، قلت لو قطعت اللايف الواحد يعني يستر معاكم يشغل الجنريتر وكده، لكن الحمد لله الكهرباء اتسترت معاكم. اتمنى انه our next meeting will be better. We will have better infrastructure in Sudan. We will have continuous supply of basic services, and we'll have unity, as Eisa said, across all ethnic groups, political parties, and we have set our priorities straight. We put يعني إنه دائما الناس تكون عارفة إن الآن البرايورتيز بتاعت الناس مختلطة في السودان. يعني يجب إنه الصحة تكون هي one of the top priorities in Sudan, instead of spending in other things I don't want to mention. Like the other day I was going to my workplace in the Nile Street, and I saw the club, the sport. I don't know what kind of, the national club, which belongs to the, what do you call it? The intelligence, whatever. كان اسمه جهاز الأمن ده. And actually the construction has stopped after the revolution, but unfortunately the construction is going on. And this club, The national club actually cost, I think, more than $20 million. So we still don't have our priorities straight. $20 million could have done a lot, could have built a lot of health centers in the rural areas, could have built hospitals, could have equipped hospitals that, or could have made Khartoum Hospital magnificent again, great again, as Trump usually used to say. He's now gone. And also, I remember I went to Ain one day, Ain, the capital of Wilaya Sharq Darfur, Eastern Darfur state, and from the airport I was going inside the city and I found a very, very nice building, well-established buildings, and I said, "Oh wow, you have now you have development going on here." And they told me those buildings belong to the security forces, Jihaz al-Amn برضه. Until we have our priorities straight, until we have the health and education as a priority, I think we are going to be lagging behind the other nations. Even the neighboring Ethiopia now, they have their priorities straight, although they have a lot of problems. But Ethiopia, for example, they have a CDC, they have a public health institute that we don't have. They have a better health system. So we should have our priorities straight, and we should actually work together to achieve better health for everyone, because development cannot be achieved without good health. Thank you so much for this opportunity again. And mentioning, and actually I mentioned also المسؤولية المجتمعية, the society role in fighting Corona. In my previous life with the other Sudanese doctor union in Ireland, I forgot the name. And speaking about the unity, I hope next time myself and Eisa come to present. You have only one union, Sudanese doctor union in Ireland. Thank you so much, and great to be your guest today.
ألف شكر دكتور عزان. I've seen that National Intelligence Club before في شارع النيل, and I totally believe you can, with that amount of money that they spend on it, you can build a level 1 trauma center, massive tertiary hospital in Khartoum that's going to serve a lot of people all over the country. No prioritization, the money goes in the wrong way all the time. Hopefully now, after the change, money will go the right way, in the right hands. اسمحوا لي اترحم على شهداء اليوم في حادث حركة المقرئ الشيخ نورين وصحبه الكرام. توفوا اليوم. كان إمام الجامع أبو بكر الصديق لفترة طويلة، وتشرفت بالصلاة من خلفه. أنا نحسبه عند الله شهيدا. Second thing, let me congratulate Mr. Joe Biden. At last, Trump is gone. I don't think he's going to come out of the house, the White House, the easy way, but it's gone now. It's a massive, huge difference now. ختاما اسمحوا لي أن أشكر دكتور عيسى حامد على وقته. The time now in Myanmar is after midnight, and he's still here with us. He gave us plenty of his time in the weekend where there are family and commitments. Let me thank as well دفعتي وصديقي الدكتور Ezzan كما يحب أن تنطق على وقته ومشاركته. والشكر لكم جميعا على الحضور. تقبلوا شكر نقابة الأطباء السودانيين بأيرلندا SDI، وتقبلوا شكري وتحياتي. أنا أمين عمر السكرتير الأكاديمي. شكرا لكم جميعا على حضوركم، وطبتم وطابت أوقاتكم. السلام عليكم ورحمة الله.